level since the 1970s as a proportion of GDP. My department is playing a leading role in that mission by making the biggest changes in the way we support local economic growth in a decade, with around £5 billion of investment through the Levelling Up Fund and Community Renewal Fund, and our ongoing investment through the £3.6 billion Towns Fund. At the same time, we're reforming our planning system to build more homes and ensuring that developers pay their fair share through a simpler and faster and more transparent infrastructure levy.
Rob Butler.
Thank you, Mr. Speaker. Aylesbury has seen unprecedented housing growth over the last 25 years, and we'll see much more in the years to come. Our infrastructure is currently at breaking point, with traffic congestion a real problem for local people. Now, one way of alleviating this would be approval of the Aylesbury spur of East-West Rail. What steps can my right honourable friend take to work across government, and perhaps particularly with the Treasury, to secure funding for this vital link to ensure that housing development is matched by the appropriate infrastructure?
Well, my honourable friend is right to highlight the need for transport infrastructure investment in the Milton Keynes, Oxford, Cambridge arc, which is one of the fastest growing and most economically dynamic parts of the country. I understand how important the connection is to his constituents, and I know that he's met with the Chief Secretary to the Treasury and the Rail Minister to make the case for connecting Aylesbury to East-West Rail, an overall project that I've been a long-term supporter of. He's right that more homes requires more infrastructure, and that's why we have a £7 billion National Home Building Fund alongside the new infrastructure levy proposed to capture more of the land value uplift and ensure that when homes are built, they're built with the appropriate infrastructure as well.
Let's go to Miriam Cates. Miriam.
Thank you, Mr. Speaker. It's been a privilege to co-chair the Stocksbridge Towns Fund Board and work with the local community to develop our plans to regenerate the town with the £24.1 million of government investment. But there are other towns in my constituency, like Penistone and Chapeltown, that would also benefit from a coordinated community-led approach. So what plans does my right honourable friend have to encourage local councils to support communities to develop their own local infrastructure development strategies?
Secretary-General.
Well, I enjoyed visiting Stocksbridge just over a year ago with my honourable friend and was delighted to see that their £24.1 million town deal was announced by my right honourable friend the Chancellor at the budget. I very much look forward to seeing their exciting proposals come to life, including a new visitor centre for a gateway to the Peak District. But I do recognise the point she makes, that she represents many other towns like Penistone and Chapeltown, and we want to ensure that they too can benefit from much needed regeneration funding. That's why bidding is now open for our Levelling Up Fund, worth £4.8 billion, which will deliver genuine local priorities by putting local support, including that of a Member of Parliament, at the heart of its mission. When I visited Stocksbridge, she kindly gave me an umbrella as the birthplace of the modern umbrella, and so with the new local town deal and an excellent MP, I'm hopeful that the sun will keep shining on her constituency for many years to come.
Let's go to Giles Watling. Giles.
Thank you, Mr. Speaker, and I'd like to thank my right honourable friend for his earlier answer. But back in 2017, a £200 million funding gap was identified for the infrastructure projects in tendering. Now, as the Secretary knows, there's ongoing work to address areas of greatest need, such as roads, hospitals, and a personal campaign of mine to upgrade the rail services to Clacton and Walton. But our most significant funding gap, as we look to deliver new housing, remains the reported £100 million hole in our adult social care budget. Can I ask my right honourable friend what his department is doing to address that?
Well, I thank my honourable friend for his question. This year, local councils will have access to an additional £1 billion for social care, on top of continuing all existing social care funding. He's right to raise the point that new housing requires new social infrastructure as much as it does hard infrastructure in terms of roads and railways. That's why we're bringing forward the infrastructure levy, which will capture more of the land value uplift and ensure that developers pay a fair share. And it's also why we're working with local authorities, including Essex County Council, to ensure that they can access the Housing Infrastructure Fund and our new House Building Fund to get billions of pounds of investment into their communities.
22 withdrawn, so we go to Dr. Kieran Mullen. Kieran.
Thank you, Mr. Speaker. Along with the rest of the Crewe Town Board, I was very pleased to submit our bid for investment early this year to help Crewe build back better. I campaigned for us to get a town deal, and I know what a positive impact it can have. Can the Secretary of State update me on when we can expect to hear what I hope will be positive news for Crewe?
Well, I was delighted to receive Crewe's town investment plan in January. Having visited my honourable friend's constituency many times over the years, I'm excited to see the ambitious plans that have been developed for the town centre to welcome visitors and shoppers and creating an integrated HS2 hub station. The plans are very well developed. My officials are currently conducting assessments and I look forward to making an announcement in due course.
Substantive question to Minister Hall.
Thank you, Mr. Speaker. We have so far allocated over £9 billion directly to councils since the start of the pandemic, and local authorities are expected to receive over £3 billion of additional support in 21-22, responding both to expenditure pressures and to loss of income. This takes the total support we've committed to councils in England to tackle the impacts of COVID-19 to over £12 billion.
Select Committee, Clive Betts.
Thank you, Mr. Speaker. On the 11th of November, together with other representatives from Sheffield, we met the Minister to express concern that the loss of income to leisure centres in Sheffield was not being refunded to the council because the centres are managed by an arm's length trust. I understand now from the council that the government have recognised that the extra expenditure given from the council to the leisure trust to compensate for loss of income has now been refunded at least significantly by the government, and I thank the Minister for that and for the help he's given. Unfortunately, locally, the Lib Dems have tried to claim that some of this money has not gone from the council to the trust to fund services in Sheffield, but gone to fund leisure centres in Scarborough. Will the Minister reassure me and residents in Sheffield that the money that he has given to Sheffield Council has gone properly to fund services in Sheffield and nowhere else? Indeed, as the Chair of the Trust has confirmed, all the money given to the Trust by Sheffield Council is funding leisure centres in Sheffield and nowhere else.
Minister.
Thank you, Mr. Speaker. Can I thank the Chair of the Select Committee for that question? I was grateful to meet with him and with Julie Dorr last year. I know how important this matter is to him and to his community in Sheffield. We've provided councils with a range of support for COVID pressures on local leisure services, including unring-fenced grants, income compensation, and the specific National Leisure Recovery Fund. In all cases, Sheffield, of course, will comply with the funding conditions. My expectation would be that all of that funding should be used locally to support local services in Sheffield, and he is absolutely right not transferred to other areas.
Nick Fletcher.
Thank you, Mr. Speaker. Number 26.
Thank you, Mr. Speaker. HMOs are a valuable part of the housing market and play an important role in delivering affordable accommodation, which is often vital in the communities that they serve. Most HMOs provide accommodation that is decent and safe for those living in it. Where HMOs may pose a risk to the well-being of their inhabitants or to the local area, we've given local councils robust powers to regulate standards and management of HMOs. If necessary, local planning authorities can also limit the proliferation of HMOs by consulting to remove the national permitted development right.
Nick Fletcher.
Thank you, Mr. Speaker. I'm sure that my right honourable friend will agree with me that while most residents in HMOs are law-abiding individuals, there is no escaping the fact that very often the residents in such premises lead extremely different lifestyles to those of their neighbours. This has been a particular issue in the towns of Rosington and Conisbrough, where residents from these two towns have complained that the increasing number of HMOs has caused a spike in antisocial behaviour and a loss of community spirit. Despite this, I have not seen the government mention the necessity in combating this phenomenon in the planning white paper. What reassurances can my honourable friend therefore give to my constituents that the government recognises the issue that HMOs cause in small towns and villages, and what work is his department in conjunction with local authorities to ensure that such residences are located in more appropriate areas?
Thank you, Mr. Speaker. Mr. Speaker, I feel a huge degree of sympathy for the members, constituents of Rossington and Conisbrough who may have suffered antisocial behaviour as a result of HMOs in their area. And I understand that my honourable friend is working assiduously on behalf of his constituents to tackle this. But we have given local authorities robust powers to regulate standards and management of existing HMOs, including HMO licensing, penalties of up to £30,000 for breaches of the law, and for the worst offenders, banning orders. I'd urge my right honourable friend to press Doncaster Council to exercise these powers if appropriate.
We now come to topicals with Secretary General.
Mr. Speaker, one of the biggest divides in our country has been between those who can afford their own home and those who cannot. And that's why I'm pleased today to see the government launch our new mortgage guarantee scheme as we strengthen our commitment to build back better from this pandemic. Today's 95% mortgages will help families and young people get onto the property ladder without the excessive burden of a large deposit, helping to turn generation rent into generation buy. And as we cautiously reopen the economy and return to a semblance of normality, we are ready to grasp the economic lifeline that comes from getting out and supporting local businesses, returning to pubs, restaurants and cafes, providing our local economies with the love and support that they need as we continue down the recovery roadmap. And as we seize this economic boost, we will ensure prosperity is shared across all of the UK's nations and regions. Having announced the details of our landmark new Levelling Up Fund, the Community Ownership Fund and the Community Renewal Fund at budget.
Dame Diana Johnson. Dame Diana.
Thank you, Mr. Speaker. Can the Secretary of State explain why local people in Hull and the East Riding of Yorkshire were not trusted to be asked about what they wanted devolution to look like locally and to help shape those plans, rather than just being told by Whitehall what they must have with permanent changes to local government in return for vague and, to date, unspecified promises of regeneration?
Secretary General.
Well, I'm not sure what the Honourable Lady is referring to there. When we approach local government reorganisation, we do so only in circumstances where there is a good deal of local support, and we've taken forward a small number of proposals this year, including in North Yorkshire. Those are then subject to a consultation exercise where we notify stakeholders and take great care to take the opinions of the local population, and then of course it comes to a minister under the Act for an ultimate decision. Were local government reorganisation or a devolution deal to be negotiated in the Honourable Lady's part of the world, and I know there is some local interest, we would of course follow all of those legal requirements.
Let's go to Dr. Kieran Mullen. Kieran.
Thank you, Mr. Speaker. We're all making the most of our parks at the moment, but we've seen a surge in littering. Will the Minister join me in thanking groups like Crew Clean Team, Shavington Clean Team, Nantwich Litter Action, and the Great British Spring Clean's Million Mile Mission campaign, who play their part in battling this blight? But can he also remind council of the need for them to use their powers? As in your area, as found in Cheshire East, the number of fines issued dropped again last year for the third year in a row.
Secretary.
Well, I'm very happy to join my honourable friend in thanking the hard work of all the volunteers that he mentions. As lockdown lifts, we want the countryside to look its glorious best this spring and summer. And he's absolutely right to say that councils should be using the powers that are available to them. Littering not only blights local communities, but is ultimately a criminal offence. And we've raised the maximum penalties for littering to £150, and we've published guidance for local authorities on the use of their powers.
Shadow Secretary Steve Reid.
Thank you, Mr. Speaker. There's been a 400% increase in donations to the Conservative Party from developers under the current Prime Minister. In the interests of transparency and to allay growing concerns about sleaze at the heart of government, will the Secretary of State publish notes of all the meetings that he, his advisers or representatives of Number 10 have held with any of those developers about changing the planning system and what they asked for?
Secretary General.
Well, Mr. Speaker, all ministerial engagements are already published through our regular official engagement notifications, and all donations to political parties, whether that be the Labour Party or the Conservative Party, over the statutory amount are also published. Of course, planning decisions and the production of government policy has nothing to do with donations that are made to political parties, and there's a complete separation of the two.
The Council for the Protection of Rural England, the National Trust, the Town and Country Planning Association, the Royal Institute of British Architects, the Royal Town Planning Institute and others have all condemned his planning reforms for handing too much control to developers and blocking communities from objecting to individual applications in areas zoned for growth or for renewal. Given their increased donations to the Conservative Party, is he paying back developers by selling out communities?
Well, once again, the Honourable Gentleman makes a low point. What we're doing is getting people onto the housing ladder. Once the Labour Party cared about young people, people on low incomes, people on social housing waiting lists, but those days are long gone. This is the party of home ownership. This is the party standing up for the millions of people whose jobs depend on housing and construction. This is the party that's supporting the brickies and the electricians, the people out there trying to earn a good day's living. The Honourable Gentleman needs to get his priorities straight and support people who are working hard, trying to get on the housing ladder and trying to get this country going again after the pandemic.
Let's go to Peter Gibson. Peter.
Thank you, Mr. Speaker. Like many, I was glad to see our high streets begin to reopen last week, with retail restarting and outdoor seating enabled for hospitality venues like that on Coniscliffe Road in Darlington, serving Hash Bar, Orb Micropub and 22s. Does my right honourable friend agree with me that in order to support our high streets in the long term and build on the success of the Towns Fund, we need to reform planning restrictions to help revitalise our town centres?
Well, my honourable friend is absolutely right. The changes being seen on our high streets up and down the country are seismic, and they require fundamental reforms to our planning system, and that's exactly what this government is doing. And what a contrast that is to the party opposite. Their only policy, as far as I can tell, is to create a new review led by somebody who we asked to do a review 11 years ago. Now, I have a great deal of respect for Mary Portas and I enjoy listening to her views, but we have already taken forward most of her recommendations. We are taking action. The party opposite is doing nothing and is letting the towns and cities across this country go into neglect.
Virendra Sharma. Virendra.
Thank you, Mr. Speaker. Last month, the Secretary of State appointed 2 new members of his departmental board. Dame Alison Nimmo is a director at Berkeley Group, accused of endangering the health of thousands in my constituency with the Southall Gas Works development. How can I or my constituents have confidence in his department's ability to regulate Berkeley Group when, in the words of the Cabinet Office, one of their own advisors and leads the department?
Well, I'm disappointed to hear those remarks from the Honourable Gentleman. Casting aspersions over the integrity of Dame Alison Nimmo is a new low for the opposition. Alison is one of the most respected women in business today. She led the Crown Estate impeccably for many years, and now we are fortunate to benefit from her experience, her commitment, and her public service. I think it is completely wrong of the Honourable Gentleman, no doubt handed a question by the Labour Party whips, which he doesn't know anything of, but nonetheless, I think it is very poor that he would cast aspersions over a great public servant who I am proud to have working with me at the department.
I don't think Secretary of State needs to cast aspersions on where he got his question from. I think it is his own constituency. Let's go to Andrew Percy. Andrew.
Thank you, Mr. Speaker. Councillor Anne Handley, myself and other members of the Town Deal Board have submitted what we feel is a very strong Town Deal bid for Goole, which will include multi-million-pound regeneration of the town centre, leisure centre, and also bring gigabit fast broadband to Old Goole. We're keen to get on and get these projects delivered. Can the Secretary of State provide us with any details of when exactly Goole will know exactly how much it's getting from the government through our Town Deal bid?
Well, I thank my honourable friend. I was pleased to receive Goole Town's investment plan in January, which includes ambitious plans to diversify and to repurpose the town centre and revitalise Goole's economy. My officials are currently conducting their assessment in the usual way, and I look forward to making an announcement in due course, which, if it is a positive one, will build on the excellent news we had at the budget of a free port in the Humber, bringing jobs and regeneration to the whole region.
Thank you, Mr. Speaker. Homelessness is a big factor for ex-prisoners reoffending, particularly women. In January, the Ministry of Justice announced £20 million for 5 pilot schemes of temporary accommodation. However, 3 months on, there's still no evidence of how this service will account for complex specific needs for vulnerable women leaving prison. So can the Secretary of State tell me how his department will work with the MOJ to ensure that support services for women in permanent accommodation from their release is more than 12 weeks?
The Honourable Gentleman raised an extremely important point. 53% of those people sleeping rough on our streets are ex-offenders. So a crucial component of our strategy to end rough sleeping must be ensuring more offenders, whether male or female, leave prison to good quality, secure accommodation, whether that's in the private rental sector or in social housing. I'm working very closely with my right honourable friend, the Lord Chancellor, and together we put in a bid for the spending review which he refers to, and I'll be able to update him in due course on those plans. But the Ministry of Justice will be an integral part of our strategy.
We've now got Jason McCartney. Jason.
Thank you, Mr. Speaker. According to the Woodland Trust's State of the UK Woods and Trees report, 1,225 ancient woods across the UK are currently under threat from development, and the number of ancient woods being damaged by development is still increasing. How will the Secretary of State's department continue to strengthen planning policy further to properly protect this irreplaceable habitat?
Well, I was pleased to read of the Woodland Trust's recent campaign, and my department received over 10,000 postcards from supporters of the Woodland Trust, which I've had the pleasure to look over in recent months. We have proposed changes to the National Planning Policy Framework to set an expectation that all new residential streets should be lined with trees, and this builds on previous changes to the framework where we strengthen protections for ancient woods and trees. My right honourable friend, the Environment Secretary, will shortly publish further details of our wider cross-government commitments.
Let's go to Caroline Ansell. Caroline.
Thank you, Mr. Speaker. The eviction ban instituted by my right honourable friend last year, due to end in May, has undoubtedly saved untold misery. Now, COVID-related rent arrears built over successive lockdowns are a very present danger. Could my right honourable friend outline how measures will evolve to support individuals, families and landlords to sustain viable tenancies as we move into recovery?
Minister.
Well, thank you, Mr. Speaker. I'm grateful to my honourable friend, who's a doughty campaigner for her constituents in Eastbourne. I think we got the gist of the question she was asking, which is the support that we provided for renters during the pandemic. We wanted to strike the right balance between helping tenants in need. That's why we've increased the welfare net, increased discretionary housing payments, increased the local housing allowance to 30% of the local market costs, and we've also ensured that landlords have access to justice. As we transition out of the roadmap to recovery, we'll be providing some further details on the next steps that we envisage to protect renters and also to ensure that landlords get the best service and the best help that they need.
Let's go to Douglas Chapman. Douglas.
Thank you very much, Mr. Speaker. In March, the Minister told the House that he would reach out to the devolved government to help more clarity on the organisation and delivery of the Shared Prosperity Fund in Scotland. So on this issue, when did he last meet with the Scottish Government ministers? and what specific Scottish Government policy objectives will be met by the Shared Prosperity Fund?
I met with representatives of the Scottish Government 2 weeks ago.
Welcome the recently announced package of support for those arriving from Hong Kong on BNO status. Can my right honourable friend confirm that all corners of the United Kingdom will receive support to enable those who arrive to be able to settle where they wish and to contribute to our economy, for example, through setting up a business?
Well, as a champion of freedom and democracy, we are living up to our historic responsibilities to the people of Hong Kong. I've made it the mission of my department to ensure that all BNO status holders and their families have the very best start as soon as they arrive here. That includes an initial £43 million package across all UK nations to provide targeted support for new arrivals, including English language tuition where necessary or housing costs for those who will need it. We're creating 12 welcome hubs right across the UK to give practical support for everything from applying for a school place, registering with a GP, to setting up a business. This month, I met with 4 Hong Kong families who've recently arrived in the UK, and their profound sense of optimism about the future reaffirmed my belief that this programme will enrich our country for generations to come.
I'm sorry for the others who didn't get in, but unfortunately the question seemed to have taken a long time to answer. I'm now suspending the House for 3 minutes to enable the necessary arrangements for the next business. Thank you. Order. Order. I call the Secretary of State, Matt Hancock, to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus. Mr. Speaker, this virus is diminished but not defeated. Cases, hospitalisations and deaths are back to the levels we saw in September. Throughout the crisis, we've protected the NHS, and there are now 2,186 people in hospital with COVID across the UK, down 94% from the peak. And the average number of daily deaths is 25, down 98%. Because of this brighter picture, we've been able to take step 2 on our roadmap, and it is brilliant to see the high streets bustling with life once again, and to hear the real-life crowd back in Wembley this weekend, especially if you're a Leicester City supporter. And now, with fewer COVID patients in hospital, the NHS is already turning to focus on the work to tackle the COVID backlog. Step by step, we're returning this country towards normal life, and we're on track to meet the roadmap set out by the Prime Minister. Last week, we hit our target to offer a vaccine to priority groups 1 to 9, and we're on track to offer a vaccine to all adults by the end of July. But throughout, we must be vigilant, cautious and careful, because we want this road to be a one-way street. Mr. Speaker, the uptake of the vaccine has been astonishingly high. For all over 50s, uptake is 94%. Enthusiasm among those in their late 40s was so high that when we opened up the booking system last week, they briefly overloaded the website. And we can see the result of this uptake in the real world. The latest data show that 98% of people aged between 70 and 84 now have COVID-19 antibodies, which are crucial to the body's ability to fight the disease. 98%. This is the protection our vaccination programme is spreading across the whole United Kingdom. Uptake amongst all ethnic minority groups continues to increase. PHE estimate that the vaccination programme has prevented over 10,000 deaths up to the end of March, and it will protect many, many more as the rollout continues. We know that the first dose gives significant protection, but the second dose is crucial to make people as safe as possible. On Friday and Saturday, we saw record numbers of second doses, over 499,000 on each day, and I'm delighted to tell the House that as of midnight last night, we've now given second doses to over 10 million people across the United Kingdom. 3/4 of over 75s have now had both jabs, rising to 4/5 of over 80s. Mr. Speaker, the vaccine is our way out of this pandemic, and I'm delighted that it's being taken up in such huge numbers. We'll do everything in our power to drive uptake, especially when it comes to protecting the most vulnerable. And the vaccination rate amongst care home staff is currently below 80% in over half of all local authority areas. Many care homes have called for vaccinations to be required for those who work in these settings. We have therefore launched a consultation into whether we should require care home providers that care for older adults to deploy only workers who've received their COVID-19 vaccination unless they have a medical exemption. We all know that older people living in care homes are at the greatest risk from this virus, and I believe we have a duty of care to protect the most vulnerable, so we'll consider all options to keep people safe. Mr. Speaker, as we deliver on stage 2 of the vaccination programme to vaccinate all remaining adults in the UK, we must also turn our attention to what comes next. The biggest risk to our progress here in the UK is a new variant that the vaccine does not work as well against. We know from our response to other viruses like flu that we need updated vaccines to tackle mutated viruses. So I can tell the House that as we complete the programme of first and second jabs, we're ramping up plans for a booster shot to make sure our vaccines stay ahead of the virus. We've already procured enough vaccine doses to begin the booster shots later this year. We'll be working with our current vaccine suppliers and new suppliers like the CureVac partnership to work out which vaccines will be effective as a booster shot and to design new vaccines specifically targeted at the variants of concern like the variant first found in South Africa. Our goal is to ensure the vaccine protects against this dreadful disease, whatever it throws at us, to keep us safe and protect our much cherished return to a normal way of life. Mr. Speaker, the booster shot is important because it will help protect against new variants. Until then, we must remain vigilant in case a new variant renders the vaccines less protective, because new variants can jeopardise the progress that we've made here in the UK. Thanks to our early investment in COVID genomic sequencing, we have in this country one of the best systems to spot and suppress new variants wherever we find them through a combination of tough measures at the border, our genomic sequencing capability, and our massive testing system. Mr. Speaker, I'd like to inform the House of another new development in our testing system. We've been piloting Pharmacy Collect, which is a system in which you can go and pick up tests for free from a pharmacy. And I'm delighted to tell you that following the successful pilot, we have now rolled out Pharmacy Collect to over 9 in 10 pharmacies, meaning that the universal testing offer, in which anyone can get tested up to twice a week, is now free and easily accessible to anyone who wants it. You just have to go to your local pharmacy, sir. Mr. Speaker, I'd also like to update the House on our response to 2 new variants. One, the variant of concern first identified in South Africa. We've now detected a total of 557 cases of this variant since it was first identified in December. We've seen a cluster of cases in South London, predominantly in the London boroughs of Wandsworth, Lambeth and Southwark, and identified single cases over the last week in Barnet, Birmingham and Sandwell. Around 2/3 of these cases are related to international travel and have been picked up by the Day 2 and Day 8 testing for international arrivals. However, we have seen a small amount of community transmission too. As soon as these cases are discovered, we acted quickly to put in place enhanced testing, tracing and sequencing. In Lambeth and Wandsworth, we've brought in 19 mobile testing units in our largest surge testing operation to date, and we're distributing test kits to housing estates, secondary schools, places of worship and workplaces. I'd urge everyone who lives in these areas, whether you have symptoms or not, to get tested regularly and help us to keep this variant under control. 2, we've recently seen a new variant first identified in India. We've now detected 103 cases of this variant, of which, again, the vast majority have links to international travel and have been picked up by our testing at the border. We've been analysing samples from these cases to see if this variant has any concerning characteristics like greater transmissibility or resistance to treatments and vaccines, meaning that it needs to be listed as a variant of concern. Mr. Speaker, after studying the data and on a precautionary basis, we've made the difficult but vital decision to add India to the red list. This means anyone who is not a UK or Irish resident or a British citizen cannot enter the UK if they've been in India in the previous 10 days. UK and Irish residents and British citizens who've been in India in the past 10 days before their arrival will need to complete hotel quarantine for 10 days from the time of arrival. These rules will come into force at 4 a.m. on Friday. Mr. Speaker, India is a country I know well and love. Between our two countries, we have ties of friendship and family. I understand the impact of this decision, but I hope that the House will concur that we must act, because we must protect the progress that we've made in this country in tackling this awful disease. Mr. Speaker, another way that we've kept the country safe is through maintaining a strong supply of PPE. At a time of massive global demand, we secured supply lines, created a stockpile to see us through the winter, and created onshore manufacturing capacity here in the UK. And I'm pleased to inform the House that since February last year, we've now distributed over 10 billion items of PPE to protect people working in the NHS, in social care and in public service right across the country. Delivering so much PPE at such speed and scale has been an extraordinary effort that has not only helped us through the crisis, but given a lasting legacy for the future. If I may, Mr. Speaker, two further points. I'd like to inform the House that today we have appointed Professor Lucy Chappell as the Chief Scientific Advisor to the Department for Health and Social Care. Professor Chappell has a stellar track record in science and research, including leading on the work on vaccinations in pregnancy. And she's worked very closely with our National Institute for Health Research, for which she will now be responsible. I'm sure the whole House will join me in congratulating Professor Chappell on her appointment. And finally, Mr. Speaker, last month we laid before the House our one-year status report on the Coronavirus Act. I'm sorry to say that the report contains an error relating to Section 24 of the Act concerning Home Office measures on data held for national security purposes. Full details are set out in a written ministerial statement being laid today. The error doesn't change the substance of the report, as we'll be laying the regulations to expire Section 24 alongside other provisions as soon as parliamentary time allows. Mr. Speaker, in summary, we are moving down our road to recovery. Vaccinations are rising, the pressure on our NHS is falling, and as we enjoy the freedoms that are returning, let's take each step safely. We must hold our nerve, follow the rules, while the vaccinators do their vital work, and I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. Can I start by saying I'm sure I've no doubt that the Downing Street was reluctant to cancel the Prime Minister's trip to India, but as a member for Leicester, I'm immensely proud of our deep ties and bonds with India, but I think in the circumstances it was the correct thing to do, because we must always be vigilant, we always must be driven by the data, and of course the variants are the biggest threat to our progress. Tackling these variants does demand that vaccination continues to be rolled out successfully, and I again pay tribute to all involved in that. But of course, uptake levels, although improving, as he said in his statement, are still too low in some minority ethnic communities. So will he provide extra resources to those local communities who need them to drive up those vaccination rates? We will look carefully at his details for vaccinating social care staff, but he will know, of course, that every attempt throughout history to force mandatory vaccination has proved counterproductive. Why does he think this will be any different? And of course, even with high levels of vaccination across the population, there will be significant parts of the population unvaccinated, children, for example. So the virus will be endemic, as the Chief Medical Officer has recently confirmed. SAGE's papers model a third wave this summer. So how do we avoid that third wave this summer? And can I suggest to him that one way we could do that is to pay higher sick pay and expand its scope. Some of the poorest and the lowest paid will continue to suffer and be left exposed to this virus unless we fix this. We shouldn't just glibly accept these health inequities. It could mean urban areas left behind, remaining with restrictions and higher infection rates as well. So for the millionth time of asking, will he please fix sick pay? Now, coming on to India. India has the most cases in the world at the moment. I think more than around 250,000 confirmed cases a day and going up. This is one of the world's steepest surges right now. And uploads of Indian sequencing to the Global Open Access database show the new double mutant of B1617 variant becoming dominant in India in the past few weeks, outcompeting our own homegrown Kent strain. And as of today, UK COG reports 135 cases of B1617 in the UK, 115 in the last 28 days, the fastest growing variant in the UK in the last 3 weeks. If most of those are imported, so we welcome his announcement about adding India to the red list, although I hope there will be support and help in place for constituents like mine who are legally in India and will need to will want to return. But we also now have cases in the community not linked to international travel. Now, I understand that he is carrying out analysis of those samples, but surely we now need to start surge testing and designate B1617 as a variant of concern. Because how long will it take before more definitive evidence that it is more infectious or has immune escape? How long will it take before we know that? Because we already know that this variant carries mutations of concern in other variants. And if we have learned anything in the past 12 months, is that this virus ruthlessly exploits ambiguities, that we must act fast when the situation is controllable, because in a few weeks' time, it might not be. Now, he didn't mention vaccine passports in his statement, And does he anticipate that vaccine passports will soon be needed for football games or concerts? Because, if I may, Mr. Speaker, and as he said, Leicester City have indeed made it to the FA Cup final, and they are a team challenging for Europe on merit, Mr. Speaker, who always put fans first. But many who are anticipating going to a football match later this year will be asking if they need a vaccine passport, will it be based on 1 dose or 2? He may have seen data from the Centre for Disease Control in the US or Israel that suggests that you are still infectious after 1 vaccine dose. So can he update us on that front? And finally, Mr. Speaker, on the latest Sunday Times revelations about Greenhill's and Cameron's lobbying of him and the various highest NHS officials about the payday financing scheme, which wasn't an act of altruism to staff in a pandemic, but an investment plan to package up loans to sell to investors, with the former Prime Minister, not nurses, in line for a payday windfall. Cameron wrote in one of his emails, quotes, "As you can imagine, Matt Hancock is extremely positive about this innovative offer. They sought a partnership with NHS Shared Business Services, which is of course jointly owned by the department. They sought access to personal and financial data of thousands of NHS staff. They wanted their electronic records for their own commercial gain. And their plan was to expand into the social care sector as well, where staff are low paid, are on 0 hours contracts, and because the market is fragmented and made up of private providers, the supposed non-profit offer would not apply, presumably. There are meetings and communications with a parade of the most senior NHS officials, including former Health Minister Lord Pryor and Baroness Harding. At least 30 trusts may have spent valuable time considering the adoption of this untested payday lending scheme, and all because the Secretary of State succumbed to his old boss Cameron's lobbying. So again I ask him, will he publish all the text messages, all the emails, all the correspondence with David Cameron? Can he tell us how many NHS leaders and officials did Cameron and Greenhill lobby and meet? How many NHS trusts in total were approached about this expensive, unneeded scheme? And while we're on it, on the issue of shared business services, can he also tell us why he never declared his own links to Topwood, the confidential document shredding firm, who were still on Friday night, until it was curiously taken down, using the NHS logo on their website to promote themselves? With so many accusations and allegations of sleaze and cronyism, these are basic questions that deserve clear answers. Mr. Speaker, NHS staff deserve a pay rise and support, not these payday loan apps forced on the NHS by speculators trying to make money out of the pandemic. How can he possibly defend it?
Thank you very much, Mr. Speaker. If I just address the final point first, as I said to the House last week, my approach was and is that local NHS employers are best placed to decide whether to take up offers of pay flexibilities. And when it comes to NHS shared business services, ministers are not involved in decision-taking in NHS shared business services. And when it comes to the other matter that he raised in terms of my declarations, which are only known to him and to everybody else because I followed the rules in letter and spirit and made that declaration, I rather agree with the Leader of the Opposition rather than the Right Honourable gentleman who said that he was not suggesting that any rules were broken. If I now turn to the COVID-related matters, I welcome his support for the decision to put India on the red list. This isn't a decision that we take lightly. He's right to ask about surge testing to make sure that we limit the spread as much as is possible of the variant first found in India, and we will be doing that, I can confirm. I welcome his support for vaccinations, which he has demonstrated at all turns, and I think it's partly because of this unanimity across this House, which includes all parties, about the importance of vaccination, that we have this absolutely spectacular level of uptake. He says that every attempt at mandatory vaccination is counterproductive. I gently point him to the fact that, that surgeons need to have a vaccine against hepatitis B, and so vaccination that is tied to work, in fact, has a long-standing precedence in this country. He asks many questions about certification, but he knows that there's a review of certification that's underway at the moment, being led by my right honourable friend, the Chancellor of the Duchy of Lancaster, and I'm sure that the Chancellor of the Duchy will have heard his representation and questions and will be able to address them in that review. And finally, he says that we must avoid a third wave by sticking to the rules. And he's right. We should avoid a third wave if we can. And the way we can do it is by sticking to the rules and getting the jab. That's why this vaccination programme is so important. It's why the roadmap is cautious and we hope irreversible. That is the plan. And with the 10 million second vaccines and the progress in the vaccination programme that we've seen in the last few days, weeks, and indeed months, I'm very pleased to say that we're on track.
The Select Committee, Jeremy Hunt.
Mr. Speaker, it's a pleasure to see you face to face after some time. And the Health Secretary is absolutely right to put India on the red list and absolutely right to explore mandatory vaccination of certain frontline workers, however difficult and sensitive that decision may be. But he will know in the last week we've seen that NHS waiting lists have risen to nearly 5 million people, nearly 1 in 12 of the population of England, the true cost of the pandemic. But it's equally true that we've had capacity problems in the NHS for some time. So that's partly why we've opened 5 new medical schools. But does he agree with the letter that he's recently received from the 3 main health think tanks that say that Health Education England should be given a statutory duty to publish regular, transparent, independent, objective workforce projections so we can actually make sure we really are training enough doctors and nurses? This is an approach strongly supported by the Select Committee and by the Academy of Medical Royal Colleges. I hope he will support it too.
Thank you very much, Mr. Speaker. Well, we'll certainly consider that. I've seen the letter. We've discussed the question. But I would also also add that we have a record number of doctors in this country, in part thanks to the work that my right honourable friend put in place when he was in my shoes. We have a record number of nurses, over 300,000 for the first time in the history of the NHS. So we do need, of course, to look to the future and make sure that we're preparing for the future, as the letter suggests. We also need to make sure we keep driving this project of delivering 50,000 more nurses into the NHS over this Parliament right now. So I look forward to having a more substantive response to my right honourable friend, but I can hear his encouragement to make sure that we take steps in this direction.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you very much, Mr. Speaker. While the vaccine programmes across the UK are going well, vaccine-resistant variants remain a major threat. I welcome that the Prime Minister has now called off his visit to India due to their devastating surge in COVID. Cases of the B1617 Indian variant in the UK are still very low, but it has been doubling every week despite lockdown, suggesting that, like the Kent variant, it is much more infectious than the original. I therefore welcome that India is being added to the red list to reduce further importation. But will he not now consider extending hotel quarantine to all arrivals, as travellers from red list countries can currently avoid it by coming via a third country? We've already seen increased numbers of the South African and Brazilian variants in European countries, from where travellers are not placed in hotel quarantine. And more infectious or vaccine-resistant variants could emerge in any country, and we simply wouldn't know about it until it's too late. The pandemic is still accelerating, and as well as causing appalling suffering and death in other countries, it clearly poses a threat to the people of the UK. So does he not recognise the need for a more cooperative global response to COVID if we are to bring the pandemic under control and allow a safer return to international travel and commerce?
Thank you very much, Mr. Speaker. Well, I certainly agree with the Honourable Lady on the final point, and it is a point on international collaboration and work together that, along with the Foreign Secretary and the Prime Minister, we are working incredibly hard on, and using the UK's presidency of the G7 and the enthusiasm of the new administration in Washington to try to drive that international collaboration, and in particular collaboration amongst like-minded democracies in favour of an open and transparent, science-led response to pandemics. And I hope that she'll concur with that approach. When it comes to the new variants of concern, of course, when looking at the numbers, it is very important to distinguish between community spread and spread connected to travel. By taking the action that I've just announced to put India on the red list, we are, of course, restricting yet further the likelihood of incursion from India of somebody with a new variant. But the majority of the cases that we have seen already in this country have been picked up by the testing that we have in place now for every single passenger entering this country. And so that is a sign of the system working and is now being strengthened.
Let's go to Bob Blackman. Bob.
Thank you very much, Mr. Speaker. And I'm delighted to say that I've had my second dose of Oxford AstraZeneca vaccine, and so far, no ill effects. But can I also ask my right honourable friend, in Harrow, we've had surge testing, particularly because we've had a relatively small number of the South African variants discovered. Literally thousands of people have been tested, but one of the most frustrating things is these tests then have to be sent off, and there appears to be an extremely long turnaround time before we get the results of those tests. What can he do, therefore, to speed up the results of getting these tests? Because otherwise, people aren't aware of whether they've got the variant or whether they should take particular action.
Mr. Speaker, he's absolutely right to raise this important issue. And I know that representing a very significant number of constituents from the Indian diaspora, I know that this is an important announcement for him and his constituents. What I'd say in terms of the turnaround time is we have managed to reduce somewhat the turnaround time for the sequencing of positive tests, but we are also introducing a new type of test which can detect not just whether you're positive, but whether you have one of the known variants without having to go through a full sequence. And that can give you a snapshot much, much faster within a matter of hours as to whether a positive result has one of the known variants before sending it off to sequencing so that you can see any new variant that you don't know about. So we are introducing that technology. It's starting in the Lighthouse Lab, the testing facility in Glasgow. We're rolling it out across the system. It's an important tool to make sure we can get this turnaround time of spotting the variants down faster.
Mr. Carmichael.
Thank you very much, Mr. Speaker. Can I say to the Secretary of State, it is quite astonishing that his statement today had absolutely nothing to say about the government's plans for vaccine ID cards, which apparently is something that's being trialled. Just last week, the Equality and Human Rights Commission told us that vaccine ID cards and possibly even the mandatory vaccination scheme that the Minister is trumpeting today could be unlawful. But yet this House has had no opportunity to express a view of them at all. When is the government going to share and come clean with their plans for vaccine ID cards with this House?
I refer the right honourable gentleman to my previous answer, which is that the Chancellor of the Duchy of Lancaster is leading a review into this area, which will report in due course.
Pauline Latham.
Thank you, Mr. Speaker. Can I congratulate my right honourable friend on the phenomenal rollout of the vaccine programme? It's been astonishing, and I also have had my second vaccine, which makes me feel much happier. We've been told regularly that we are following the data, not the dates. But sadly, it seems to be the other way around, that we are following the dates and not the data, because we know, for instance, in Derbyshire, there are huge swathes of villages and towns that have no COVID whatsoever. And that's repeated over all sorts of areas of the country. Last week, I managed to go out several nights because I could, which was great, and the atmosphere was fantastic. But we do need to start getting businesses back to normal. We need to get hospitality businesses operating fully functioning and using their indoor spaces. Some of the outdoor spaces I've been in are quite enclosed. So can we not go indoors as well now?
Well, I'm absolutely delighted that my honourable friend, like my honourable friend, the member for Harrow, they are both 1 in 10 million having had their second jab, and it's really, really good to see the hope that the vaccine brings and the cheer. And that links to her second part of her question about the speed of the roadmap. The reason for the timing set out in the roadmap is that we want to see the impact of one step before we then take the next step. We are but 1 week on since we took step 2. That is a significant reopening, and we've all seen it, no doubt, in our constituencies. We've seen it around the country, and we want to see the impact of that on the data before taking the next step, so that we can have confidence that this is an irreversible path, a one-way street, as I put it. That's the reason for the way that we've set it out, and that's how we're planning to proceed.
Imsham.
Sorry, excuse me, Mr. Speaker, I just wasn't concentrating the way I should have been. Minister, I also, along with others, welcome the rollout of the vaccine and the importance of it. But at the same time, Minister, suggested they were feeling now it's now time to look at the waiting list, and I put one on record. What steps have taken place to get routine operations such as hip replacements and tonsil operations back on the table to address the waiting lists that are eye-watering and vastly concerning? When we hear of children on an urgent waiting list for tonsils and adenoids to be removed last year, but due to dips in oxygen levels, which were considered urgent at that time, but now appear to be okay. Very, very worrying. Secretary.
Thank you very much. My honourable friend raises an incredibly important point, because this waiting list is very significant. It's built up because of COVID, but we must tackle it. We're absolutely determined to. And he, like me, will have seen the figures last week in terms of the increase in the waiting list in England, but the waiting list has increased in all parts of the UK. We've put in extra funding. In total, for next year, it's an extra £7 billion of funding in England, with the Barnett consequentials in the that's gone to the 3 devolved administrations. And that is there to make sure that we can get through this backlog, whilst also, of course, dealing with COVID and the infection prevention and control that's needed to tackle COVID. So this is it's a vital task. He's quite right to raise it, and it's something we're working on very hard.
Thank you, Mr. Speaker. My right honourable friend is rightly proud of the stunning performance of the vaccination teams around the country, and of course I pay tribute to those who've been engaged in that in and around Ashford. I'm sure he agrees with me that it's particularly important for care workers to be vaccinated, not just care home workers, but domiciliary care workers who go from house to house providing essential care as well. So could he say what he's doing to encourage take-up among those care workers to get as close to 100% as possible?
Yes, it's incredibly important that all care workers take up the jab if they possibly can, unless they have a vital medical reason not to. Because the jab, of course, not only protects you, but it protects people you're close to. And if you are a care worker, that means you are close to people who are vulnerable. That's in the nature of the job. That's why I think it's right to consider within care homes, saying that you can only be deployed in a care home if you have had the jab. We're looking into that. We have not said that for those who work in domiciliary care, in caring for people in their own homes rather than in a care home, because it is those in care homes who are the highest risk of all. But I would absolutely urge anybody who is a carer and works, whether they work in social care or an unpaid carer, if they haven't already got the jab, then please do get the jab, not just to protect you, but to protect those over whom you have a duty of care.
Let's go to Debbie Abrahams. Debbie.
Thank you, Mr. Speaker. Mr. Speaker, as the UK rolls back lockdown restrictions, the global death toll has reached 3 million. And the World Health Organization is warning that the world is approaching the highest rate of infection so far. With 3 new variants on 3 continents, all of these variants now in the UK reduce efficacy of the different COVID vaccinations against these variants, it is clear that the UK success in fully emerging from this pandemic is codependent on how well the rest of the world is doing. I asked the Health Secretary about global coordination of surveillance of new variants back in February, and the World Health Organization is now consulting on this. So can the Health Secretary update the House on our response to this consultation?
Yes, this is an incredibly important subject, and I agree with the substance of what the Honourable Lady asked in the question. She's quite right to raise this. We've put in place the new variant assessment platform, allowing any country around the world to use our enormous genomic sequencing capability if they want to sequence positive cases in order to discover what is happening in their countries, but also our borders testing system, where all positives are sequenced, means that we in fact get a survey from around the world through those who have travelled to the UK, and we can relay that data back to individual countries so that they understand that better. Of course, it would be far better if something like the new variant assessment platform is run on a multilateral basis globally, for instance by an organisation like the WHO. We are engaged with the WHO on making sure that is available, but my view was we needed to get on and offer it to everybody and then build a network of labs around the world which can make that offer so that sequencing can be available in every country, because it is currently far too patchy.
Let's go to Harriet Baldwin. Harriet.
Thank you, Mr. Speaker. And can I add my congratulations to the team that's managed to give 2 vaccinations to over 10 million people. That's fantastic news. And given the risk of variants, I do welcome the difficult decision that he has made to add India to the red list. Can I ask the Secretary of State what research he has commissioned into those people who have, like my honourable friends, had 2 vaccinations, and what possibility there might be that people who have had 2 vaccinations are able to go about their daily lives with fewer restrictions than those who have not?
Thank you very much. Well, that latter question is really a question tied to the certification work. We have not hitherto, as she well knows, said that rules should be different for people who are vaccinated as non-vaccinated, but we know that some other countries are proposing to say that that'll be the case for international travel, so we do need to have a way of showing that, of proving that. But we have not yet to come to any conclusions about how we should do that and whether we should do that domestically. That is a matter for the Chancellor of the Duchy of Lancaster. But in terms of measuring how effective a second dose is, we have tests in the field right now to follow a sample of people who've had both tests, to have them tested regularly, weekly, typically, to then be able to check whether or not they test positive and therefore test the effectiveness of both of the vaccines in the field. So far, we've published the results of that after 1 jab, and very early results are coming through after 2 jabs, and in the next couple of weeks we'll have some really rich data, I should hope, on that, because we've now seen a very significant proportion, a number of second jabs, 10 million as of midnight last night.
Let's go to Fariel Clark. Fariel.
Thank you, Mr. Speaker. Mr. Speaker, the vaccination rollout for the majority of the country has been nothing short of amazing. And I would like to thank the local NHS providers in Enfield and across the country for their Herculean efforts. Sadly, for some parts of the country, including many parts of my constituency of Enfield North, a postcode lottery appears to be emerging, where vaccination rates are stubbornly low and falling behind the rest of the country. What is being done to combat this, and what additional support will his department be providing the areas with consistently low vaccine rates?
Yes, we've got a huge amount of work on to tackle exactly the phenomenon that she describes. I want to thank people in Enfield who've been working on the vaccination programme, because they've done incredibly well, but there is much more to do. And we have to make sure that we make the vaccine more accessible and make sure it is as easy to access, and make sure people have the reassurances if they may be hesitant. The Minister for Vaccine Deployment, Minister Zahawi, is leading on these efforts, including innovative approaches that we're currently trialling. For instance, allowing multi-generational households to be vaccinated at once. To see how we can drive up uptake in those groups that we haven't seen that high uptake. As I said, for over 50s, the uptake overall is 94%, which is far higher than my best possible hopes just a couple of months ago. But that final 6%, if we can reduce that, every percentage point that comes off that, the safer and safer we all get.
Let's go to Stephen Hammond. Stephen.
Thank you, Mr. Speaker, and can I refer the House to my register of interests? Can I thank my right honourable friend for his statement and the extraordinary rollout that is still continuing, and I want to thank all the health workers across Wimbledon and South West London. In his statement, my right honourable friend was right to identify the risk of the new variants and the genomic sequencing and booster. Can he confirm to the House, firstly, that there will be an availability of rapid testing with tests that provide results quickly, that tests will identify the new variant, and can he confirm that the booster programme will be rolled out on a similar basis to the vaccine programme, which has been so successfully rolled out?
Yes, absolutely. The booster shot programme will be rolled out in a similar way to the first two jabs. There will, of course, be some differences, not least because of the interaction of an autumn COVID vaccination programme with the autumn winter flu vaccination programme. We still need the final clinical results as to their interaction, whether you can have them both at the same time, which would obviously be logistically easier, but these matters need to be resolved. The reason for the announcement today is that we want to be absolutely clear that a booster shot programme will happen this autumn, later in this year, and we are determined to make it as efficacious as possible, because ultimately dealing with these new variants will require booster shots, especially for the most vulnerable.
Let's go to Imran Hussain. Imran.
Mr. Speaker, over the last week, several serious concerns have been raised with me around the managed quarantine hotel system, with harrowing stories of families with young children stranded in airports because they cannot contact the booking provider to arrange accommodation, and others in quarantine hotels left without food for days on end. Can the Health Secretary tell me just what he is doing to urgently resolve this, frankly, absolutely shambolic situation with the booking system, and what he is doing to end the inhumane treatment of quarantine hotel guests by ensuring that food is not only provided on time, but that it meets the faith and dietary requirements of travellers, particularly those fasting during Ramadan?
Thank you very much, Mr. Speaker. I'm afraid I don't agree with the prognosis. We, of course, are very careful to ensure that the vast majority of people who go through the managed quarantine service, the hotel quarantine, have a good experience. Of course, they have to be in a hotel when they would rather not often, and so it is an unusual situation, but it has been put in place with great sensitivity, and I'm very grateful for all those who've worked so hard on it, not just in my department, but amongst the hotels and the airports and the carriers. However, the Honourable Gentleman clearly has some significant individual concerns, and I'd be very happy to make sure that the Minister for Public Health, Minister Churchill, meets with him to hear those individual concerns, to try to make sure they're resolved, and in particular the point about making sure that that food provision is appropriate for those fasting at Ramadan, which of course is very important.
Let's go to Julian Sturley. Julian.
Thank you, Mr. Speaker. Given the 7-day rolling average of COVID deaths is now 24.9, with just 10 yesterday, while in normal times the daily cancer death toll averages over 450, a figure sadly likely to rise due to the delayed treatment and disruption of the pandemic. What is the government doing to catch up with the cancer screening and operations backlog and get the health service back towards other medical conditions so that the death toll from non-COVID cases does not become the worst legacy of this emergency?
Yes, my honourable friend is quite right to ask about this. It's an incredibly important topic. I'm delighted to say, I'm pleased to say, that over the second peak this winter, the amount of cancer work, cancer surgery, cancer treatment continued much more close to normal. But he's quite right that in the first peak it was reduced significantly. We are very focused on this backlog that's been created by the pandemic. But I am also pleased, of course, that the death toll from COVID is coming down. In fact, the very latest data shows that the number of deaths recorded with COVID after 28 days that is published today is 4. Now, those numbers do tend to be lower at the weekend, and each one of them we mourn, but nevertheless, it reinforces his point that it is vital that we get on with getting through the backlog that's been created by the pandemic.
Many thanks, Mr. Speaker. I wanted to challenge the Secretary of State about the inexplicable delay in adding India to the red list of countries. So I welcome the announcement that India will now be included on that list and hope very sincerely that this will not be another stable door moment in this government's response to the coronavirus pandemic. Mr. Speaker, the Secretary of State will know that the SNP have committed to increase NHS funding in Scotland by 20%. Will he commit to a similar uplift for NHS England in order to help drive the recovery of the NHS after coronavirus and to truly build back better?
Mr. Speaker, I recently saw the figures for the proposed increase in NHS spending in Scotland. And the proposed increase is lower than in England. It's lower than the money that has been passed over to the Scottish Government from UK taxpayers to the Scottish Government to spend on the NHS in Scotland. My question is, what's happened to the money for the NHS in Scotland that was given to the SNP government in Holyrood? They have not spent it on the NHS, but we know that they have many wasteful projects. Now, thankfully, we work very closely together on important things like the vaccination effort, which has been a true UK success story. But this question of the missing millions for the NHS in Scotland is one that we need answers to from the government in Holyrood.
Let's go to Robin Miller. Robin.
Thank you, Mr. Speaker. Can I thank my right honourable friend for the foresight and the early investment decisions made on vaccines 12 months ago. Here in Aberconwy, the result is in falling infection rates, tangible sense of hope, albeit one coloured with frustration as we watch businesses in England open ahead of us. We have the second oldest demographic in Wales, and it's right that their environment is protected to ensure their well-being. This is properly a priority. However, can my right honourable friend give the elderly and the vulnerable and their loved ones assurances that they will one day be able to leave their accommodation, to visit family, resume employment, and otherwise pick up their old routines?
Yes, of course. We want to get back to normal in terms of care home residents. Of course we do. We are taking steps in the right direction. In England, I can't comment on the situation in Wales. That, of course, is rightly a responsibility for the Cardiff administration. But of course, as we progress down the roadmap, I hope that we're going to be able to make further progress.
Let's go to Kerry McCarthy. Kerry.
Thank you, Mr. Speaker. At today's meeting of the all-party group on ME, we discussed the overlaps between ME and chronic fatigue syndrome and long COVID, and obviously there are some striking similarities. Could I ask the Minister what assessment he has made of the impact that contracting COVID would have on people with ME CFS? And given their vulnerability, will he now do a bit of a U-turn and make them a priority for vaccination?
Well, of course, the prioritisation for vaccination when it comes to those who are vulnerable is clinically determined. And I know that this question has been looked into. And we're also looking into work on the links between ME and long COVID, which share some similarities, but also are different conditions. And so it's an area that needs further work and further research. There's no doubt about that. If there is an update to the clinical advice on prioritisation and whether those with ME need to be in group category 6 or category 4, then of course I'll absolutely update her. But thus far we're following the clinical advice, and that's the approach we've taken overall.
Let's go to Caroline Noakes. Caroline.
Thank you, Mr. Speaker. I was really pleased to hear my right honourable friend reference the appointment of Professor Lucy Chappell and the work on vaccines in pregnancy. Can you please update the House on what is being done to reassure young women that there's no plausible way that vaccination can affect fertility? And can he also let us know how quickly he expects pregnant women who we know might be immunosuppressed to be called forward for their vaccination, or will they have to wait for the age band that is appropriate?
Thank you very much. Well, I was absolutely delighted that following the work of Professor Chappell and others, on Friday we were able to make this announcement with respect to the vaccination for those who are pregnant. The prioritisation remains as with people who aren't pregnant. So it will essentially be by age, unless there's another reason that you might be in a higher group, for instance, if you're a social care worker. So it doesn't affect the prioritisation, but hitherto the advice had been understandably cautious because clinical trials are not done on people who are pregnant. But now there's very clear advice that if you are pregnant, when it's your turn, come forward, take advice, have a discussion about your individual circumstances with your clinician, and people can, subject to that individual circumstance, which of course is appropriate in pregnancy, people can be vaccinated. So I'm grateful to my right honourable friend for raising this. It was a really important announcement on Friday. I probably, Mr. Speaker, should have included it in my original statement, but unfortunately I was already rather long. I'm absolutely delighted to Professor Chappell and the whole team involved, because it was a big team effort to make sure that we could make this progress.
Let's go to Lillian Greenwood. Lillian. Just have to pass on. Sir Edward Lee.
Scott Morrison, the Australian Prime Minister, has just announced that he has no plans to open up his borders. And of course he's absolutely right. Now I'm speaking, I apologise completely with the benefit of hindsight, but I'm sure everybody would agree that if we'd done what Australia had done, we could have opened up our economy months ago. They've only had 910 deaths, only 29,000 of infections. So what I want to hear from the Secretary of State is he's going to resist those very powerful lobbyists from the travel industry and from the airline industry and from airports, and he's going to be absolutely determined in following the evidence. We don't know what variants are out there in the world, in not allowing unnecessary travel, and really be tough with this red list.
Thank you very much, Mr. Speaker. That is the approach that we've taken so far since the introduction of the red list and the hotel quarantine, and we are seeing through the testing of every single passenger who comes here, we now have essentially a survey of the world, so we can see where the cases are, where the new variants are from people who are coming through that testing regime. But I'm grateful for his wise counsel.
Yvette Cooper.
Thank you, Mr. Speaker. The Health Secretary is clearly right to put India on the red list and to safeguard the vaccine programme from new variants. But the India variant has been under investigation for 3 weeks. Other neighbouring countries with lower and slower COVID rates were put onto the red list 10 days ago. The Hong Kong this week has identified 47 COVID cases just on a single Delhi flight. And we have still 16 more direct flights, many more indirect flights from India here before Friday alone. So can he explain, contrary to his previous answer, why India wasn't put on a red list 10 days ago when other countries were? Can he publish the Joint Biosecurity Centre's assessments, recommendations and criteria, and also publish a full genomic analysis of which countries all of the new variant cases are arriving from, so that we can see where the border gaps still are in the measures that he has in place, and make sure we don't keep having these delays.
Secretary of State.
Well, I would, what I'd say to the Right Honourable Lady is we keep all of these decisions for each country under constant review. The challenge of the genomic data is that some countries have excellent coverage of genomic sequencing and others don't. And actually that isn't particularly correlated with their income. For instance, South Africa, a middle-income country, has an excellent genomic sequencing. And so we take the decisions very rapidly when we need to. We keep all of this under constant review, and I'm glad that she welcomes the decision to put India on the red list today.
Mark Harper.
I'm grateful, Madam Deputy Speaker. Can I add my congratulations to all those that have been involved in the fantastic vaccine rollout that the Secretary of State set out in his statement, which is obviously breaking the link between cases, hospitalisations and deaths, which we're seeing dramatically from the figures. Many members of the public and businesses, having looked at the roadmap, which he also mentioned, will have seen that as of the 21st of June, I think the government's expecting, and the public are expecting, the country to be broadly back to normal. But of course, there is the small print about the reviews on social distancing. So can he confirm to the House and to the public that as of the 21st of June, he expects us to be broadly back to normal without social distancing? If that's not the case, can he set out what the evidence base will be for that decision?
Secretary of State.
Thank you. Well, any decisions like that would be based on the evidence, and we have far more evidence now than we did when making these decisions previously. Now, I fully expect that there will be some areas of life without the need for laws in this place where people will behave more cautiously than previously. The wearing of masks is one where before this pandemic, wearing a mask in public in this country was extremely unusual, and I would imagine that would be. I imagine that some people will wear masks and choose to wear masks for some time to come. Our goal is to manage this virus, to manage the pandemic that it's caused, more like flu. In fact, like flu. Flu comes through each year. We do take action to deal with flu. We take action on nosocomial infection in hospitals. We take action in terms of the flu vaccine programme. But we don't stop normal life as we know it. Now, that is the overall attitude and approach. He mentions that there are 4 reviews that were set out as part of the roadmap, and they will, of course, have to conclude. But that is my hope, because as he knows that I very firmly believe this vaccine is breaking that link, and you can see it in the data every single day, and you can see it in the way that the country is responding, and it's uplifting, Madam Deputy Speaker.
We now go to Barbara Keeley.
Thank you, Madam Deputy Speaker. I want to add my praise to the team rolling out vaccines in Salford, led by Salford Primary Care Together, who are doing a remarkable job. The current guidance on visits out from care homes says that any resident who makes a visit outside a care home must self-isolate for 14 days on their return, even if all they've done on their visit is to sit outside with a family member. This is longer than you have to quarantine when returning from red list countries, including India, which has the most cases in the world. This is clearly disproportionate. So can the Secretary of State set out what he is doing to enable regular testing to be used to cut this self-isolation requirement for care home residents?
Secretary of State.
Thank you very much. I think the Honourable Lady raises an important point on a subject that she knows extremely well. And I'm not going to, if I may, Madam Deputy Speaker, could I give her the respect of considering the question and writing to her with a full reply, because it's a very important question, and I want to make sure that we get it right, and maybe we can then have a correspondence to make sure we get to the right result.
Dr. Liam Fox.
Thank you, Madam Deputy Speaker. The UK's vaccination programme has been an international trailblazer. The strategic aim of preventing the NHS from being overwhelmed has clearly been met, and I'm delighted that my right honourable friend, who I think has done a tremendous job as Secretary of State throughout the pandemic, appears determined not to allow a shift in the goalposts and to follow the cautious pathway out of lockdown. But can we please, and can he please ensure that we have a rational and balanced discussion about viral variants? Viruses always mutate, and there will be an unavoidable level of risk that we will have to get used to post-pandemic, unless we're to become a perpetually frightened, introspective nation, the opposite of global Britain.
Secretary of State.
Well, my right honourable friend has deep experience in this area. I'm very grateful for what he said, and that was very kind. He's absolutely right about the fact that viruses, of course, always mutate, and we can rise to that. We can respond to that as we do with flu. It's another area in which the parallel with how we manage flu as a country is the right one, because each year the flu virus, most years, the flu virus mutates. We work out, observing the Australian winter, what is the most likely variant we'll get in our winter. We adjust the vaccines to that variant, and then we roll them out over the autumn. That sort of programme, I think, is likely to be needed in this country for some time to come. We will start later this year with the booster shots, and then we will make progress after that, according to the evidence as we see it. And, Madam Deputy Speaker, I hope he wasn't trying to make a point of something. I always try to be rational. It's sometimes hard.
We'll now return to Lillian Greenwood.
Madam Deputy Speaker, I hope I don't still sound like a robot. The gradual easing of restrictions over recent weeks has come as a great relief and is very welcome. But we know that the pandemic has caused a colossal backlog of unmet healthcare need, including dental care. Many people have been unable to access any treatment for dental problems, and checkups have simply not been happening for over a year now. Can he set out the steps he's taking to enable dentists to begin to clear that backlog of treatment? And when there's already huge inequality in oral health, and when so many people are facing financial hardship, what's he doing to ensure that people don't miss out on vital preventative treatment, preventative checkups, because they can't afford them?
Madam Deputy Speaker, she's quite right to raise this. We have maintained access to urgent dental treatment throughout the pandemic. We put in place dental centres to be able to do that in the first peak, and dentistry was not closed in the second peak. And indeed, we've put in place an incentive for to get dental practices really motoring. Of course, there's infection prevention and control, which needs to be updated as the prevalence of the disease comes down. But making sure that we have those checkups, I think, is incredibly important, because it is one of the most important preventative measures that there is, especially for children. And I hope, with her interest and enthusiasm on this subject, she will support the proposals for much more widespread fluoridation of water, which we're proposing to put in to bring before in legislation when parliamentary time allows. That was part of the white paper we published in February, because that is one of the biggest steps we can take to protect dental health.
We now go to Ellie Reeves.
Thank you, Madam Deputy Speaker. The NHS has had its busiest and most critical year ever, fighting the pandemic, delivering the vaccine rollout, and all whilst continuing to provide routine care and treatment. We owe our NHS workers so much, and yet this government is proposing just a 1% pay increase, not even the 2.1% previously promised. Can the Secretary of State not see that after the year we've had, that this is an insult to their heroic efforts? And will he commit to getting a pay rise for staff that truly reflects the value of their work?
Well, the admiration in which I hold NHS staff holds no bounds. The question of pay is rightly one for the independent pay review body, and I look forward to their publication.
We now go to Robert Halfon.
Thank you, Madam Deputy Speaker. On Friday, I visited the vaccination centre at Harlow Leisure Zone to see the work they're doing, the extraordinary work. Will my right honourable friend thank the remarkable NHS staff and volunteers, both at the Harlow Leisure Zone and at Lister House, for vaccinating 40,000 residents in Harlow with a first jab. Given what my right honourable friend said previously about Public Health England and the move to Harlow, will he meet with me and colleagues to discuss the move and the exciting proposals that Public Health England have to ensure that Harlow and the surrounding area of West Essex becomes the public health science capital of England?
State.
Well, thanks very much. Can I add my praise to his for the vaccination centre at Harlow in the leisure centre? They've been working incredibly hard, and we are all very grateful. I'd also add his long list, which I fully endorse, Essex County Council, who have lent into the vaccination effort right across Essex. I'm always very happy to meet him, and with the recent announcement of the UK Health Security Agency, I think now is a good time to have a discussion on this topic.
We now go to Munira Wilson.
Thank you, Madam Deputy Speaker. I've been contacted by several constituents who ordered very expensive tests from companies recommended on the government's website as part of the test to release scheme. Yet some have never received their tests, or some never received their results, some received their tests late with fear of being in breach of the rules. They've had to battle for refunds, and others, we have heard, have had to leave home to get their tests, which undermines the whole scheme. So what, if any, vetting does the department undertake before listing these companies, especially as demand will no doubt increase given the government's so keen to open up international travel again?
Date.
Yes, she's quite right to raise this. We have kicked 2 suppliers off the list of approved suppliers for testing for international travel. We are quite prepared to do more if they don't meet the service obligations that they sign up to. If she wants to send in the individual evidence, then we will absolutely look at it. We keep this constantly and vigilantly under review because the companies that provide tests must meet their obligations in terms of timeliness, in terms of treating their customers fairly and reasonably. Some of them, 2 of them, as I say, did not continue to meet those specifications, so we took them off the list of available testing suppliers. I'm quite prepared to do that for more if that is what it takes.
Now, this session is supposed to finish in 3 minutes' time. We have 12 more questioners. I'd like to be able to get everybody in. A fair number of these are in the chamber, so I'm sure that everybody will be very cooperative in keeping their questions very short, and would also ask the Secretary of State if he could be equally brief in response. Angela Richardson.
Thank you, Madam Deputy Speaker. Following the important announcement last week, I know many expectant mothers in Guildford and around the country will welcome the certainty that they can safely come forward for a vaccine when offered. Can my right honourable friend confirm that we will continue to take every precaution to ensure pregnant women have the support that they need to make an informed decision about what is right for them and their health?
Secretary of State.
Absolutely. This decision was taken on the basis of the best possible science, significant amounts of data from pregnant women who have already been vaccinated, so people can have confidence to come forward, get the advice that they need for their specific circumstances, and then get the protection of the jab.
Patricia Gibson.
Thank you, Madam Deputy Speaker. The Scottish Government and the First Minister have committed to a full public inquiry later this year into all aspects of the handling of the pandemic, including care homes. Will the Secretary of State confirm that he supports a full public inquiry into the UK Government's handling of all aspects of the pandemic in England as well? Secretary of State.
Well, this is obviously a matter for powers greater than the Health Department. It is something that the Prime Minister has clearly set out his views on, and that's what I'll stick by.
Holly Mumby-Croft.
Speaker, along with the chair of the Brain Tumour All-Party Parliamentary Group, I previously raised the issue of residents who travel abroad for medical treatment having to pay hundreds of pounds for COVID tests to travel in and to return. This is affecting my constituent David Hopkins and others across the country. Will the Health Secretary work with the Secretary of State for Transport and urgently find a way to allow patients such as David to use free NHS tests for medical travel purposes?
State.
I think my honourable friend raises an important point. I'm very happy to look into it. I'm also pleased to say that the cost of tests on the that are needed for travel is coming down, and there's an important piece of work underway to see how we can get that down further. But nevertheless, she makes a strong case for her constituent.
Thank you, Madam Deputy Speaker. Face coverings are still going to be likely to be a feature to protect us against COVID-19, but yet there are people with hidden disabilities who cannot wear face coverings who face abuse. Despite having raised this on previous occasions, including once with the Prime Minister being promised an awareness campaign, nothing has happened. So can the Minister tell me when an awareness campaign will happen?
Yes, there is an awareness campaign that's been underway, and I'm very grateful for advance notice of the question. I will write to him with the full details of that, and he may say to me, sorry, Matt, more needs to be done, and in which case I will look into it. But it's a very important point, and I essentially agree with him.
We now go to Sir John Redwood.
I congratulate my right honourable friend on the big reduction in case and death numbers based on vaccination. Would he briefly update us on better air extraction, cleaning and other measures to control infection in hospitals to reassure the many patients who now need non-COVID treatment?
Secretary of State.
Yes, my right honourable friend has asked about this many times, and he's quite right to. It's not just the cleaning, but ventilation in particular is so important, and something we've learned a lot about during this during the pandemic. We've learned a lot about the importance of good ventilation, and that is now embedded in the infection prevention and control. And what I'd say is that as cases in hospitals come down, then hospitals across the country are separating out as much as is possible those who might have COVID or do have COVID from people who are coming to hospital having been tested, so knowing that they don't have COVID. And that is incredibly important to reassure people that if you're asked to come to hospital by a clinician, it is the best place for you.
Kevin Jones.
Thank you. In response to my right honourable friend, the member for Leicester South, the Secretary of State said that it was up to local NHS trusts whether they took up the Greensill Payday Loan app. But in the Sunday Times yesterday, the email was published, which was written between David Cameron and David Gould, the head of NHS X, on the 23rd of April, which it says, as you can imagine, Matt Hancock, David Pryor, chair of the NHS, Simon Stevens, as well as many trust CEOs are extremely positive about this innovative offer. So is that email correct? Was he extremely positive about the Greensill Act? And can I ask him directly, does he not think there's something morally wrong with using poorly paid, struggling NHS staff to allow a private company to construct a financial bond then to be traded on the international money markets?
Yes. As I said to his right honourable friend, my approach was and is that local NHS employers are best placed to decide.
We now go to Mark Pawsey.
Thank you, Madam Deputy Speaker. Rugby's PCN-led vaccination centre at Lockhouse has provided over 34,000 first and 11,000 second doses to JCPI groups 1 to 9 through a fantastic team of staff and volunteers. The GPs, however, have chosen not to take part in phase 2 of the programme, and as a consequence, the centre is expected to close in mid-July. Our local doctors would prefer to vaccinate groups 10 to 12 in their own surgeries, although this is not currently an option available to them. What can the Secretary of State do to facilitate this approach to the important task of vaccinating the under 50s?
Secretary of State.
I'll look into this question. It's not one that's been raised before, because generally the use of a primary care network, so a group of GP practices to come together to offer one centre, has worked really well. So it's the first I've heard of that concern. I'll take it away and make sure that it's looked at properly.
Tamanjeet Singh Desi.
Thank you very much. Madam Deputy Speaker, the Prime Minister today cancelled his planned trip to India this week, and the Health Secretary has just announced that India has been placed on the government's travel red list amid a devastating surge in coronavirus cases there, with well over 200,000 detected on a daily basis. A new double mutation variant is reportedly more potent, and dozens of cases have been detected here in the UK too. So can the Health Secretary clarify, in order to assuage community concerns, that our vaccines are effective against this new variant?
Secretary of State.
We simply don't know that. we're acting on a precautionary basis because we do not have, I can't give him that assurance. And of course, we're looking into that question as fast as possible, but that is the core of my concern about the variant first found in India, is that there may be, the vaccines may be less effective in terms of transmission and or in terms of reducing hospitalization and death. It is the same concern that we have with the variant first found in South Africa and is the core reason why we took the decision today.
We now go to Nigel Mills.
Thank you. And can I add my thanks to the NHS in Amber Valley, who have been moving through the vaccines so fast they've even done over 70% of the age 40 to 50 by last week. What's his message, though, to those who are saying, based on media reports, that we've now reached the herd immunity level and therefore this problem has all gone away?
We don't think it's true.
37 withdrawn, so we go to Rob Butler.
Deputy Speaker, Stoke Mandeville Hospital in my constituency is home to the National Spinal Injuries Centre. Despite continuing to do excellent work throughout the pandemic, a particular challenge arose providing support to relatives of patients who need to learn together how to adapt when back at home. So can my right honourable friend assure me that planning for a third wave of COVID-19 will give full consideration to the needs of spinal injuries patients and their families?
Secretary of State.
Yes, of course, I'll give that consideration, but I'll also make the case that whilst, of course, as we open up, there may be more transmission, I very much hope that doesn't lead, in fact, we know from the data that that is highly unlikely to lead to the same impact in terms of hospitalisations and deaths, because we know that the vaccine is incredibly effective against the variants that are at large here in this country. But that's another reason to be cautious against the incursion of new variants for which we can't give that assurance.
We now go to Derek Twigg. Derek Twigg, just yet. Dr. James Davis.
Thank you, Madam Deputy Speaker. Lateral flow testing is really important in our continued fight against the pandemic, and I'm really pleased that many of my constituents have been able to access asymptomatic testing since Friday of last week. But these tests are not available to order online through the gov.uk portal as yet if you're a resident in Wales. So will my right honourable friend confirm if this will be the case shortly?
We're working closely with the Welsh Government to try to ensure that the testing offer in Wales is as rich and easily accessible as the testing offer in England. Testing has been a UK-wide programme, but of course, the more we get it into local communities, the more it must be delivered through the NHS locally. For instance, through pharmacies, as announced today, that needs to be done by the Welsh Government. But we're working closely together to try to make sure that people can get access to these tests as easy as saying Jack Rabbit wherever you live in the United Kingdom.
I thank the Secretary of State for his statement, and we'll now have a 3-minute suspension for cleaning purposes. Order, order. I call Secretary of State Oliver Dowden to make a statement.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, football is in our national DNA. We invented it, we helped export it around the world, and it has been at the heart of British life for over a century. Football clubs, of course, aren't just businesses. They define communities across the country. So along with almost every member of this House, I suspect, I was appalled by the announcement made late last night that a handful of clubs are proposing to form their own breakaway European league. These 6 clubs announced this decision without any consultation with football authorities or with government. Worst of all, they did it without any dialogue whatsoever with their own fans. It was a tone-deaf proposal, but the owners of those clubs won't have been able to ignore the near-universal roar of outrage from all parts of the football community over the past 24 hours. This move indeed goes against the very spirit of the game. This is a sport where a team like Leicester City can ascend from League One to the Premier League title in under a decade, earning the right to go toe-to-toe against European heavyweights in the Champions League. Instead, a small handful of owners want to create a closed shop of elite clubs at the top of the game, a league based on wealth and brand recognition rather than upon merit. We will not stand by and watch football be cravenly stripped of the things that make millions across the country love it. As a Conservative, I believe passionately in defending our nation's institutions and our rich heritage. They are central to our identity and help build a sense of solidarity between people from every generation and every background. And just as the government wouldn't hesitate to act when other treasured areas of our national life are under threat, nor will we hesitate to protect one of our greatest national institutions, football. This is, of course, for football authorities to handle first, and today I have met with the Premier League, the Football Association and the President of UEFA, whilst the Sports Minister has had another of a series of meetings with the Football Supporters Association. The football authorities have robust rules in place to deal with this, and I know from my conversations with them today that they are rightly considering a wide range of sanctions and measures to stop this move in its tracks. My message to them was clear. They have our full backing. But, Madam Deputy Speaker, be in no doubt, if they can't act, we will. We will put everything on the table to prevent this from happening. We are examining every option, from governance reform to competition law, and mechanisms that allow football to take place. Put simply, we will be reviewing everything the government does to support these clubs to play. I have discussed these options with the Prime Minister this morning, and we are working at pace across government and with football authorities. I want to reassure this House of a very robust response. We will do whatever it takes to protect our national game. But it's clearer than ever that we need a proper examination of the long-term future of football. To many fans in this country, the game is now almost unrecognisable from a few decades ago. Season after season, year after year, football fans demonstrate unwavering loyalty and passion by sticking by their clubs. But their loyalty is being abused by a small number of individuals who wield an incredible amount of power and influence. If the past year has taught us anything, it's that football is nothing without its fans. And these owners should remember that they are only temporary custodians of their clubs, and they forget fans at their peril. That's why, over the past few months, I've been meeting with fans and representative organisations to develop our proposals for a fan-led review. I'd always been clear that I didn't want to launch this until football had returned to normal following the pandemic. Sadly, these clubs have made it clear that I have no choice. They have decided to put money before fans. So today, I have been left with no choice but to formally trigger the launch of our fan-led review of football. The review will be chaired by the Honourable Member for Chatham and Aylesford and will be a root and branch examination of football in this country. It will cover the financial sustainability of the men's and women's game, governance and regulation, and the merits of an independent regulator. Crucially, in the light of this weekend's proposal, it will also consider how fans can have an even greater say in the oversight of the game and the models which might best achieve that. We are the people's government. We are unequivocally on the side of fans, and their voices have to be heard when it comes to the future of our national game. It starts with fans and it ends with fans. But in the meantime, we have thrown our full weight behind the football authorities and stand ready to do whatever's necessary to represent fans and protect their interests. And I commend this statement to the House.
I call the Shadow Secretary of State, Jo Stevens.
Thank you very much, Madam Deputy Speaker, and I thank the Secretary of State for advance sight of parts of his statement that he's just made. This is a watershed moment for our national game, and the statement today is welcomed, as is the Chair of the review, but it is short on detail and on the urgency that this situation merits. Fans will have noted that. The Secretary of State tweeted last night extolling the virtues of the football pyramid, but if anything exposed the government's lack of understanding of our broken football system, that tweet, I'm afraid, summed it up. Tory trickle-down economics doesn't work, and it especially doesn't work in football. Football governance is broken, football finance is broken, and football fans, whichever club we support, are ignored. The hedge fund owners and billionaires who treat football clubs like any other of their commodities have no care for the history of our football, for the role it plays in villages, towns and cities up and down our country, and especially for the fans who are the beating heart of it. They should understand their role as custodians rather than cartel chiefs. The future of our national game and all our clubs depend on it. Labour has repeatedly called for the reform of the governance and finances of football by the government. It needs government intervention to fix that broken system, and that's why we pledged in all 4 of our manifestos going back to 2010 to take action. And it's why I and my honourable friend, the Shadow Sports Minister and Member for Wirral South, repeatedly urged the government to get on with its promised review, its fan-led review of football, a promise that they made in 2019. It's nearly a year since our letter to the Sports Minister offering support and help with 16 questions that the review should focus on. We know that there are members across this House who have for the past 11 years of Conservative-led governments supported reform. So it's time, Madam Deputy Speaker, for the government to get off the subs bench and show some leadership on the pitch, because we need reform of football. It's not as if there's been a blockage here in Parliament preventing the government from taking action to sort the problems out. Former Conservative Sports Minister, the Honourable Member for Wealdstone and the Weald, has said, "No one is speaking for the football world with the independence and authority needed to address the big issues," and she's right. The Conservative former chair of the DCMS Select Committee, the Honourable Member for Folkestone and Hythe, has said, "We should long ago have reformed the governance of football," and he's right as well. And the current Conservative chair of the DCMS Select Committee, the Honourable Member for Solihull, has said, "What's needed is a fan-led review of football with real teeth." And here we have more evidence to strengthen the case for it. So I welcome the review, but why the long delay? Why create that vacuum that has allowed these Super League proposals the space and ability to become a reality? 11 wasted years when a small piece of government time could have been found to bring primary legislation forward to this House to sort the problems out. Instead of which, it's been all punditry and no progress on the pitch. And in that time, clubs and fans have suffered disasters. Fans in Bury know only too well the importance of reforming the way that football is governed, and supporters in Liverpool, Edinburgh, Manchester, my city of Cardiff, Portsmouth, and most football towns and cities have seen the damage done to clubs when profit outstrips the role of supporters in our game. We're in a global pandemic, and the owners of the 6 clubs behind this proposal think that now is the time to ride roughshod over their fans and endanger the future of football on the back of a year when fans have been at the heart of supporting communities up and down the country. What a contrast. And it's been carved out behind closed doors without consultation with fans or players, and these proposals have at their heart a plan which is so anti-football, a Super League from which you can never be relegated, in which you are always guaranteed a place because of your wealth. It represents a fundamental attack on the integrity of sporting competitions. It's very rare, Madam Deputy Speaker, that an issue unites football fans and organisations across the rivalries and divides. But this Super League proposal has managed to do just that. From supporters' trusts and groups, including the FSA, to the PFA, the FA, UEFA, the Premier League, the League Managers Association, the European Clubs Association, I could go on, it has been universally rejected for the greedy, obscene and selfish proposal that it is. So, let's act urgently. It's already too late for some clubs and their supporters. I'm asking the Secretary of State, when will the review be launched? What will the terms of reference be? Who will take part? And when will it report? And what exactly is the government going to do to stop the European Super League decimating our national game? It should explore every option, and I hope it will, whether that's a super tax on revenue or to investigating whether the proposal breaches the clear rules that govern markets and competition in this country. For football fans up and down the country, our message is clear. Labour stands ready to do whatever it takes to stop this plan, and I hope the government will make exactly the same commitment.
Secretary of State.
Well, I thank the Honourable Lady for those questions. I think hidden in there somewhere was a welcome for the approach that the government was taking and for the fan-led review. The Honourable Lady asks what we have been doing for the past year. Well, I'll tell you a few of the things that we've been doing for the past year. First of all, we've been working to get football back behind closed doors. That we were one of the first leagues in Europe to achieve that. We acted to get a third of games free to view with Project Restart, including the first ever Premier League games on the BBC ever. We acted to stop clubs going bust with hundreds of millions of pounds through COVID support schemes and ensuring that bigger clubs looked after the smaller ones with the £250 million boost from the Premier League. We acted to keep football going through the pandemic, including, for example, secure protocols to enable travel between the UK and elsewhere. And indeed, that was in the face of opposition sometimes from the party opposite, saying that we should be stopping the sport behind closed door. And now, crucially, we are working to get fans back into stadiums. Members would have seen this weekend, for the first time, very welcome at the FA Cup semi-finals, and we are working and making good progress towards a further return of fans at stage 3 of the roadmap. But alongside all of that, we have continued to engage on the fan-led review. The Sports Minister and I have been engaging extensively. Just to list a few names, I've discussed it with Anton Ferdinand, Jordan Henderson, Karen Carney. We've discussed it with the FA, the Premier League, the EFL, the PFA, the National League, the Football Supporters Association, Kick It Out, Women's in Football, David Bernstein, Gary Neville. The Honourable Lady referred to the Honourable members for Folkestone and Hythe, which I've discussed it with them, for Wealdstone, Maidstone and the Weald, discussed it with them, and indeed with the chair of the Select Committee. All of this work has been essential in making sure we get to the point where we can launch it today. As I said in my statement, I would much rather we had waited till fans were fully back and the game had been stabilised. But because of the actions that have taken place over this weekend, we have launched it now. And the Honourable Lady would have seen from my statement, it will be led by the Honourable member for Chatham and Aylesford. I hope she will command support from both sides of this House. She was an excellent sports minister, a fan, and is someone who is passionately committed to the game. We will shortly be publishing the terms of reference for the review. We'll be working at speed, and as the Honourable Lady would have seen from my statement, and I'm happy to repeat it again from the dispatch box, we will do whatever it takes to protect our game, and we will examine every single option, and we are doing that right now.
We now go to the Chair of Culture, Media and Sports Select Committee, Julian Knight.
Thank you, Madam Deputy Speaker. Just when you thought the beautiful game couldn't get any uglier, along come the Big Six and show that they couldn't care less for the fans up and down this country. Could the Secretary of State please outline for the House what specific levers he can pull to ensure football authorities come to the negotiating table rather than indulge in this unseemly civil war? And does this involve, for example, a windfall tax on these clubs? And whereas I welcome my right honourable friend's commitment to a fan-led review, and I would pay testament to the work he has done in order to ensure that football was one of the first sports to return last year. And also, I welcome the further meat on the bones. But will he tell the Big Six today that this review will have the power to recommend that their nascent Super League could be given the red card and be legislated out of existence if they insist on pressing ahead?
Well, I thank my right honourable friend for his questions. Yes, I think it is worth bearing in mind there are two parts to this. So in the medium term, we are working on the fan-led review that has been launched, but that should not stop us from taking action now to stop this proposal going ahead. And my honourable friend highlighted some of the measures we might consider taking. I can assure him that we are looking at all of those options. We are looking at competition law, and in essence, we're looking at what does the government do to facilitate matches and facilitate those clubs, and looking at whether we should continue to provide that support, because it does not strike me that the government should be providing that support in the face of this proposal.
We now go to the SNP spokesperson, Gavin Newlands, who has 2 minutes.
Thank you very much, Madam Deputy Speaker. Can I thank the Secretary of State for advance sight of his statement? And can I say I think for the first time that I agree with every single word of his statement, provided of course that he meant Scotland when he said we invented it. But it must be made clear to the clubs and the owners involved that there will be no quarter given, no concessions whatsoever in the current arrangements. It's well past time that a line in the sand be drawn. There is already a huge and unhealthy imbalance in the game, with the big clubs and the big leagues with the big TV deals holding huge sums. This insatiable thirst for more, this greed, must not stand. Club football in countries beyond England, Spain and Italy face being left even further behind. And although clubs in Scotland such as Rangers, Celtic and League Cup winners and Scotland's most successful club in the last decade, second most successful club in the last decade, St Johnstone, are not involved, this hasn't stopped widespread condemnation. Neil Doncaster, the SPFL chief exec, said these proposals, or any like them, would have an enormously damaging impact on the very fabric of our sport at all levels. We believe that any such competition would dramatically undermine the global appeal of football and would be financially catastrophic for all but a tiny minority. The proposals, assembled by a small, self-selected group of very wealthy clubs, appear to be a cynical and very worrying attempt to thwart the core principle of sporting merit, which rightly underpins European football, and they represent a clear and present danger to the sport we love. But Madam Deputy Speaker, the public are exhausted by sleaze and greed associated with the elites at the top of our society. How does this Tory government plan to eradicate greed and corruption at the heart of politics and business, and in doing so, protecting football for the fans? Or does the Minister agree with the Prime Minister that greed is good? And some overseas owners are from countries with concerning human rights records and links to dubious regimes, and may use their ownership of popular teams to sports wash their image. What actions does the government plan to counter this?
Well, I'm tempted to thank the honourable gentleman for the first line of his question, and then to stop there. From my perspective, it all went a bit downhill after that. But he's absolutely right to say, and the government will stand up to greed and stand up for the fans. And he's absolutely right to identify that even though it's English teams participating proposed for this league, it will have a severely damaging effect on all clubs in all parts of our United Kingdom. And of course, the game is as central to Scottish, Welsh and Northern Irish identity as it is to English identity. It is a sport for the whole of our United Kingdom, and it is right that we work together as a United Kingdom in order to stop this dreadful proposal.
We now go to Damien Collins.
Thank you, Madam Deputy Speaker. I welcome the Secretary of State's statement and the decision to launch now the fan-led review. But as he has said, this is a review for the medium term, and decisions will need to be taken about the Super League in the next weeks and months. From what he said today, can the Secretary of State tell me if it is clear that under existing competition law and under the existing powers of the Premier League and the FA, there is nothing that can be done to stop these 6 clubs joining the Super League? Is the government prepared to consider amendments to the law in order to give those bodies the powers they need, and in particular, to prevent clubs from joining competitions that have not been sanctioned by either the FA or UEFA?
Secretary of State.
Well, I thank my honourable friend for his question, and I pay tribute to all the work that he has done that's helped shape what we are announcing with the fan-led review. On competition law, we are already engaging with BEIS in terms of our response to it. As I've said, we rule out absolutely nothing. I know from my conversations with the Premier League and indeed with UEFA, they are already proposing to take some pretty draconian steps to stop this, but we stand ready, and we will not allow anything to stop us from doing this in terms of timing. We will get on with it as soon as we need to.
We now go to Tim Farron.
Thank you, Madam Deputy Speaker. This is a devastating attack on the English game, and it comes as a shameless, arrogant and desperate elite seek to make millions at the expense of the millions of us who love the game and love our clubs. I thought the Secretary of State's statement contained some rhetoric that I found good and urgent, and it contained detail that was ponderous and thin. So, as well as a lengthy review, will the Secretary of State fast-track legislation that would force any club seeking to break away and join a new league to first ballot their fans and to be mandated to abide by the outcome of that ballot? And will he ensure that this legislation is retrospectively active from the beginning of the current football season? Those who wish to steal and destroy the English game must be stopped. English football must be saved. And this Parliament has the power to do it, not just review it.
State.
Well, I can reassure the honourable gentleman we will be doing three things. So the first thing is we are backing the actions by the football governing authorities. At the same time, we are looking at all options, and indeed he raised some further important options as to what we should do. We will proceed at the fastest pace that is required in order to deliver that. And thirdly, this gives rise to major questions, which I should say to honourable and right honourable members, it has become apparent to me even more so. We had this promise in our manifesto. My dealings with football over the past year, as we have sought to negotiate the support that the game requires, demonstrated again the need for governance reform, looking at finance, looking at whether there needs to be an independent regulator. All of these things will now be examined by my honourable friend.
We now go to Alan Cairns.
Thank you, Madam Deputy Speaker, and I congratulate the Secretary of State on his statement and the announcement of the fan-led review. Does he agree that the pyramid structure of the English Football League gives focus to football clubs right across the country to compete and progress to the highest level based on performance and competition? But does he also recognise that it also provides the opportunity for community links and rivalry across the country, even between Wales and England, where clubs such as Swansea, Cardiff, Newport and Wrexham choose to compete and are welcomed into the English football structure? So can he confirm that the review that he's announced will also consider the interests of those clubs that may be not in England but operate in the English Football League?
Secretary of State.
Well, as almost ever, I agree with every word that my right honourable friend said. I'm very happy to give him precisely that assurance, and he's absolutely right to highlight the two biggest problems with this. It removes a large element of the competition and the joy of the game, and it risks taking money away from grassroots, which is so central to the game.
We now go to Lucy Powell.
Thank you very much, Madam Deputy Speaker. Can I thank the Secretary of State for his very clear statement? It wasn't that long ago, Madam Deputy Speaker, that I watched my club, which I now represent, Manchester City, beating Gillingham in the second division playoff finals. We are now in what you might call our glory days. But those of us who remember the Gillingham game know that the glory days don't always last. So does the Secretary of State agree with me that a closed shop league where there are no bad days and no glory days is no league at all and has no place in our national game? and that British football fans are rightly outraged by this notion, which goes against our deeply held culture of fair and open competition and backing the underdog. And this really is an American export we just don't want.
Yes, I completely agree with the Honourable Lady. We cannot have money and brand triumphing and trumping the colour and the joy of the game. Football will be massively damaged by this move.
Gareth Bacon.
Thank you, Madam Deputy Speaker. I have been a supporter of Manchester United for 42 years and held a season ticket at the club for more than a decade, so I'm aghast that the owners of my club have signed up to this proposal. It's wholly unnecessary. It will be deeply damaging on the altar of pure greed. It betrays the management, players, fans, history and tradition, not just of my club, but of the game and the wider game as a whole. So I congratulate my right honourable friend on the statement that he's made today and the tone of the statement that he made yesterday. And could I ask him to reassure us that the government will move at speed to do everything within its legal power to prevent this ghastly plan from seeing light?
Your state.
Well, I thank my honourable friend for his question. Indeed, his reaction as a loyal fan of that club has been replicated. I've heard messages from many loyal fans of all 6 of those clubs sharing the same sense of a deep frustration at it. Yes, I can assure him not only that we will act at speed, but that we have acted at speed. I was having meetings on actions both all of Sunday and today. We are moving at pace, and I'm engaging closely with Number 10 Downing Street and with the Prime Minister to make sure we do whatever is required.
Ian Byrne.
Speaker, in light of the shocking news that 6 of our national football clubs, and it's heartbreaking to see Liverpool Football Club amongst them, who are now looking to break away from the football pyramid in England, at a time when collectively we should be working together to rebuild our football communities from the ravages of COVID. The anger across the country is palpable. So, Secretary of State, I welcome the review, the fan-led review, long overdue, but can you outline how the government will act to stop capitalism and corporate greed destroying the game millions in this country love and economically many communities rely on?
Well, the honourable gentleman is absolutely right to highlight the fact that it seems extraordinary that at a time when most stadiums remain completely empty, when clubs are under tremendous financial pressure, that rather than focusing on the rebuilding of the game, on getting fans back into stadiums, they are distracted, these 6 clubs are distracted by something that is not in the interest of the game. I think it is right that we look at competition law. I think we need to look at the whole range of things that government does to help games happen, to help clubs participate in this league, and say, well, why should we be doing this anymore for those 6 clubs? And that's precisely the work that we're undertaking now.
Number 10 withdrawn, so Chiomora.
Thank you, Madam Deputy Speaker. And Newcastle United fans have long suffered from the greed and self-interest which drives Premiership owners. But this attempt to turn our national game into the cash cow of a narrow elite shows just how morally bankrupt the Premiership has become and how little government cares, because there seem to be more rules to prevent the removal of a window frame in a listed building than the wholesale destruction of this jewel of working class culture. So can he tell me, does he believe the owners of these 6 clubs meet the fit and proper person test?
Well, as the Honourable Lady will have seen from my statement, and I'm happy to repeat it, I completely agree with her. This is absolutely central to our heritage. These clubs are as much part of our heritage as the great castles and stately homes and cathedrals and orchestras of England and the rest of the United Kingdom. And we stand ready to do whatever it takes to support this. Now, the point about the fit and proper person test, that is precisely why we have got this fan-led review. It will be one of the things that my honourable friend will be looking at as we go forward. But in the short term, what we need to do is stop this in its tracks. And the 2 ways we stop this in its tracks are working with the leagues, and I gave the president of UEFA my 100% support for the measures that he outlined today. Similarly, you will see measures coming forward from the Premier League. And then the government itself, if those do not work, stands ready to take steps to prevent this from happening.
We now go to Hugh Merriman.
Thank you, Madam Deputy Speaker. Down here on the Sussex South Coast, we are very proud of Brighton and Hove Albion. 10 years ago, they were playing at the local athletics stadium. Tomorrow, they play in our world-leading Premier League against Chelsea, one of the 6 clubs who are doing their best to destroy it. These 6 clubs are not, currently or historically, the most successful 6 clubs, yet acting as a cartel, they use their clout to undermine competition. So if the 6 clubs refuse to back down in totality, can the Secretary of State look to introduce legislation to immediately break up their ownership structures and bring in the German model where 51% of the club is owned by the fans and custodians of their club?
State.
Well, my honourable friend is absolutely right to highlight the central risk here, which is it does create this closed shop, that it freezes in perpetuity what is only a snapshot of the game at this moment and makes the game so much poorer for it. And we certainly, we've examined the German model very closely. It's very interesting to note that German teams are not participating in this. That makes the case rather for the fan-led review looking at the German model, and I can assure my honourable friend that it will be doing so. And in terms of other measures we may take, yes, of course we have not ruled out legislative measures if that is required, but the first line of action needs to be with the football leagues themselves.
We now go to Tony Lloyd.
Madam Deputy Speaker, people like my own father, who was one of those who supported Manchester United in the 20s and the 30s, wouldn't recognise the stranglehold that the corporate greedy have got round the windpipe of football already. The words that the Secretary of State has spoken today are very helpful, but the corporate greedy have corporate lawyers, and he needs to guarantee that those corporate lawyers won't tie the government and, in the end, football and its supporters in knots. And so we need to see action from him quickly if legislation is needed. But can I ask him as well, Madam Deputy Speaker, is he now talking to his opposite numbers in Spain and in Italy? Because it's important that we have not a global response, but a European response to what is not simply an English or a British problem.
Secretary of State.
Yes, I can assure the honourable gentleman that those meetings will be happening this week, and we're in the process of setting them up. I've already discussed with Her Majesty's Ambassador to Paris, having a meeting with my French opposite number later this week, and I'll be seeking meetings with my Spanish and Italian opposite numbers as well.
Anthony Higginbottom.
Thank you, Madam Deputy Speaker. In forming these proposals, the 6 Premier League clubs involved have shown no regard for the impact on clubs like Burnley Football Club in my constituency, but also no regard for the fans who offer them unwavering loyalty season after season. So can I start by welcoming the Secretary of State's announcement of a fan-led review which will put supporters front and centre. But could I also ask the Secretary of State to confirm that the government will do everything possible to protect top-flight football in this country, which provides so many economic benefits to communities, including in Burnley and Padiham?
Secretary of State.
Yes, I'm very happy to give my honourable friend that assurance. And I often say that as Secretary of State for Digital Culture, Media and Sport, the 2 things that people around the world know about the United Kingdom and instantly raise with me, whether I'm speaking to an opposite number in East Asia, in North America or in Europe, they mention the royal family and the Premier League. It is a jewel in the crown of the United Kingdom, and we will do what is required to defend it.
Alex Davis-Jones.
Diolch, Madam Deputy Speaker. As a football fan and a usually proud Liverpool supporter, I am now ashamed of my club and I'm heartbroken at this outrageous European Super League proposal, which is just another example of the fundamental structural flaws at the heart of our beautiful game. It's clear from contributions here today that our country's proud and rich history and love of the game cuts across the political divide. And I'm gutted that we find ourselves coming together to push the Secretary of State once again for some urgent answers. It's also concerning to note that we've heard nothing from the government on the potential impact of these proposals on the women's game. The strength of feeling across the House and across the country could not be clearer, Madam Deputy Speaker. Time and again, this government have failed football fans, so I ask the Secretary of State, will he do whatever it takes to stop the European Super League from going ahead?
Secretary of State.
Well, the short answer to the honourable lady's question is Yes, and she is absolutely right to highlight, and I did mention in my statement the impact on the women's game. It is that this is part of how the pyramid works, as the Honourable Lady will well know. The finances that have helped the women's game go from strength to strength in recent years. It's wonderful to see the strength of the game is because of the pyramid supporting it, and that would be another big cost to this if that failed to happen.
James Cartledge.
Thank you, Madam Deputy Speaker. This is an absolutely outrageous proposal. So I strongly welcome my right honourable friend's robust set of measures that he's announced today. But on the point of competition law, these clubs will have very powerful legal teams. They have huge financial resources. So can I ask him, whatever the current legal advice is, does he accept in principle that where a league operates on the basis of not having relegation and basically based on the wealth that you have, that must be a cartel?
Secretary of State.
Well, I think my honourable friend raises a very important point, and that is a very valid interpretation of the effect of this. Clearly, I will be working with Bays and with competition lawyers to get greater clarity and definition on this, but I can tell my honourable friend I have already discussed this with the Premier League and with the FA. We are well aware that competition is going to come into play in this scenario, and we stand ready to work with them and take measures that may be required.
Brennan.
Thank you, Madam Deputy Speaker. My friend and neighbour from Pontypridd can always come next door to Cardiff City and support them if she wants a real club. This Super League proposal is the sporting equivalent of a billionaire's gated community with a football favela for everyone else on the other side of the fence. So could the very robust response, which the Secretary of State said he wanted from the government, include the Prime Minister ringing up, or perhaps even texting, the former number 10 spin doctor, Katie Perrier, who also worked on his mayoral campaign and whose public affairs agency is promoting the Super League launch? And could he tell her that this is one occasion when insider connections will not win any traction with the government, and that this betrayal of football fans and the ethos of fair competition in sport will be blocked by the UK government using urgent legislation in the forthcoming Queen's speech?
State.
Well, I'm very happy to give the Honourable Gentleman assurance that we will take the robust action that is necessary. In fact, I think the best place to start, and where I started, was speaking to the President of UEFA and the leadership of the Premier League and of the FA. I hope that their actions can stop it in its tracks, and I think we'll see some very robust action from them. I've been clear and happy to be clear again that if that does not work, then government stands ready to act. We will not wait for it not to work. We will be, we're working through the options now as to those measures and stand ready to take them at the appropriate juncture.
We now go to Jack Brereton.
Thank you, Madam Deputy Speaker. I very much support what my right honourable friend has said. And does he agree the survival of clubs like Stoke City in my constituency is the #1 priority for fans? And Labour's cynical move to try and stop football carrying on behind closed doors twice over recent months would have been catastrophic for clubs and therefore fans. So will the Secretary of State confirm that sport continuing throughout the pandemic has and will always be a priority for this government?
Well, I thank my honourable friend for his question. He is absolutely right, and I'm happy to give the assurance that we have worked tirelessly to ensure that the game has continued behind closed doors, and I will work tirelessly until we reach the end of the roadmap and we have every single seat taken in stadia so that we can get football back on its feet, because it's only at that point where we really should be considering those wider questions of the governance of the game. And it is a sort of deep sadness to me that we are having this distraction rather than getting on with getting the game back.
We now go to Gregory Campbell.
Thank you, Madam Deputy Speaker. The Northern Ireland women's football team with amateur players qualified for the first time ever for the Euros. That demonstrated what football is about. Many people regard this announcement today, Madam Deputy Speaker, as a tactical move against UEFA. Whatever it is, will the Minister back up his rhetoric today, which I welcome, with action along with the football authorities to ensure that the views worldwide of billions of fans prevail over the views and the tactics of the billionaire financiers?
Secretary of State.
Well, I thank the Honourable gentleman for his question. May I begin by sharing his congratulations for the Northern Ireland women's football team. It was a fantastic result, and we're very cheered to see it. He's absolutely right. This doesn't just isn't confined to the UK. Premier League is loved globally. English football is loved globally, and I think you can look at the reactions in France, in Spain, in Italy. It's not just here in the United Kingdom that we feel dismayed at the proposals that have been put forward. That feeling is near universal.
We now go to James Daly.
Thank you very much, Madam Deputy Speaker. Does my right honourable friend agree this proposal is motivated by greed and shows contempt for fans and the footballing pyramid? But does he also find it sad that whilst the boards of Manchester United and Manchester City were negotiating this proposal to make millions of pounds for their owners, they, together with others, did nothing to save their local neighbour, Bury FC, whose fans were also betrayed by an owner who has attempted to profit from its heritage and history?
Secretary of State.
Well, I'm sympathetic to the concerns raised by the Honourable gentleman. Indeed, I would also note that many clubs, including some of those clubs that are seeking to break away in the announcement last night, have benefited enormously from government and taxpayer support. And I think they should think carefully about the duty that they owe to taxpayers in return and whether they are discharging it with these proposals.
We now go to Chris Stevens.
So thank you, Madam Deputy Speaker, and I thank the Minister for his statement and the announcement of a review. So does the government agree with me that tougher rules are now needed and who can buy major sports clubs in the United Kingdom? And can I add my voice to other colleagues in the House for the government to look at the German model, because it is vitally important that we have a model of pre-agreed conditions requiring a minimum percentage of each club to be owned by everyday supporters and fans.
Secretary of State.
Well, I think the Honourable Minister is right to highlight the German model. I think it has merits to it, and I think it is right that the fan-led review should look at it. I should also, though, note on the flip side of this that foreign investment in the Premier League and the rest of the EFL has brought tremendous benefits to the game. It has meant that we've had very strong games played up and down the country every night of the week with some of the finest players in the world. I'm not against foreign investment in our game per se, but what that cannot be against the wider interests of the competition and ensuring that we have a rich and diverse game. And at the heart of these proposals is putting that at risk.
We now go to Lee Anderson.
Thank you, Madam Deputy Speaker. Now then, football fans in Ashfield think that common sense in football is in short supply these days. Inside grounds, we have billionaire bosses plotting to sell our beautiful game to the highest bidder. And meanwhile, outside Wembley Stadium, we have the brother of the ex-Labour leader talking nonsense about vaccinations, whilst fellow protesters shout abuse at genuine football fans. I have a simple solution. Keep these greedy football club owners as far away from our football grounds as possible. And the same goes for Piers Corbyn. Could my right honourable friend please tell the football fans in Ashfield what government plans are to protect our beautiful game inside and outside the stadiums?
State.
Well, I don't think there's a great deal I can add to the remarks by my my honourable friend, and I observed, I'm just somewhat bemused the protest that went on outside the game yesterday, and I can also assure my honourable friend and indeed all of his constituents that the government will not hesitate in taking robust action to ensure that this does not happen.
Jeff Smith.
Madam Deputy Speaker, my 50-plus years of watching Man City has brought me a lot of emotions, pain, despair, misery, more recently a lot of elation and joy, but always pride, whatever tier we were in, until last night, when the overriding emotion was shame and anger at my club being part of this. Because effectively ending competition by merit at the top of the pyramid ends hope for clubs throughout the pyramid, and it's absolute anathema to the values of sport in this country. So I want to welcome the tone of the Secretary of State's statement and ask him three things. When he speaks to the clubs, can he try and convey the anger in this Parliament and across the country at this proposal? When he speaks to the Premier League, will he encourage them to take the strongest possible action against these clubs, including my beloved Man City? And finally, a review will take time. Will he recognise that there is the will in this Parliament to take strong action quickly if necessary?
Yes. Secretary of State.
Well, I think the Honourable Gentleman spoke very eloquently, and indeed what he has said is shared by, sadly, so many supporters of those 6 clubs. I will, of course, be conveying that anger, and I'm sure that that will be reflected in the coverage of this statement today. I have already met with the Premier League, and I have said that we will support them in taking the strongest possible action, and I can also give the Honourable Gentleman the assurance that if the actions by the Premier League and UEFA are not sufficient to stop this in its tracks, I have noted the level of support for taking further measures in the House, and it gives me confidence that we will be able to get any measures through should those be necessary.
In Hines.
Thank you, Madam Deputy Speaker. Being a top Premiership club isn't a franchise, it's to be the part of the contestable apex of the whole sport, and that whole sport in turn is part of our culture, part of our heritage, part of who we are. So can I strongly welcome my right honourable friend's robustness in his statement and also him bringing forward the fan-led review, and can you assure me that in both his immediate response and in that fan-led review they can be far-ranging with nothing off the table?
Yeah. Yes, I'm very happy to give my right honourable friend that assurance. Nothing will be off the table, and he is absolutely right when he talks about the heritage of these clubs, and the owners are but temporary custodians of something that is precious to our national identity, and they really should take that responsibility seriously.
Speller.
Thank you, Madam Deputy Speaker. And interestingly, only one of these 6 clubs has always been in the top division in English football. Now they want permanent status. So the Minister's announcement of a review is welcome, or if slightly overdue, but frankly it'll be met by contemptuous indifference by these arrogant oligarchs. Because the only thing they understand is power, and the government should be using the power of the state with full force and coordinating with other countries. So will he rapidly refer them to the competition authorities, cut them off from any further public funds, and look at the tax status of image rights, just for a start, and quite frankly, drive these sharks out of British football?
Well, somewhat unusually, although not that unusually to be fair to the Honourable Gentleman. I agree with pretty much everything he said, and I can assure him that we will be looking at all of those options. And to reassure the House, we will take robust action when it is required. We will not wait for the outcome of the fan-led review. And all of the sort of things that he is talking about are the sort of things that we are discussing internally in government.
Final question to Clive Efford.
Thank you, Madam Deputy Speaker. The football's governing bodies must stand firm against this European Super League, and I welcome the statement from the Secretary of State that he's not going to leave any stone unturned to assist in that. We now control our own borders, having left the European Union. So this will be a major test for our new powers over our borders, where we can prevent people entering the country if they're not playing matches that are sanctioned by the sports governing bodies. But on the fans' review, can I ask him, will the fans be able to lead it wherever they wish to go? For instance, the right to buy shares at the time of transfer of ownership, fans being elected to the boards of football clubs. Will the fans really be able to lead and go where they want to go with this review?
Well, the Honourable Gentleman is right to highlight the point about controlling our borders, and I can assure you that we will be considering those powers if it is necessary, and those discussions are happening. The review will be able to go wherever it needs to go. My honourable friend, the Sports Minister, and I have already engaged a lot with fans, and indeed it's worth noting that the budget recently, the Chancellor announced proposals to allow fans to take stakes and take control of their own clubs, so we're already moving in that direction.
I thank the Secretary of State for his statement and suspend the House for 3 minutes for cleaning purposes.